All right. Well, good morning, everyone. My name is Dr. James Economopoulos, and I am an associate professor at Texas A&M University Corpus Christi, and we have a training today on anxiety disorders as part of our Tex-CHIP program. For those of you who don't know, Tex-CHIP is the Texas Counselor Health Integration Project, where we help prepare our students to work in integrated behavioral healthcare settings, and we have trainings on special topics. So today we're going to be talking about anxiety disorders, particularly with youth and adolescents. And I have my outstanding co-host, Bethany. You want to go ahead and introduce yourself?
Sure, thank you so much. My name is Beth. I am a third-year doctoral candidate. I've been corresponding with Angela and Jalen through email, trying to get y'all to help us with the panelists, and thank you so much for helping us. And yeah, I just kind of help Dr. I and also Sharon. She's another third-year doctoral candidate who couldn't be here. And we just really appreciate everyone being here today.
Yes. So we have two outstanding panelists. I'm also going to serve as a panelist today too. But we have Angela Ramirez and Jalen Bowman. Do you all both want to go ahead and just take some time to introduce yourselves real quick?
Sure. Hi, everybody. My name is Angela Ramirez. So I'm a psychiatric mental health nurse practitioner here in the community here in Corpus. I primarily see patients through the lifespan, but for the most part, child through adult and some older patients, but that's primarily my population. I've been in the psychiatry field for about 10 years now.
Awesome. Thank you so much, Angela.
All right. Good morning, everyone. My name is Jalen Bowman, and I'm an LPC. I currently in private practice, just started about a few months ago. After graduating from A&M, or actually during my time in the counseling program as well, I was working at MHID here, first at Youth Services, and then later at Adult Services, and now moving into private practice. And I currently see adolescents and adults.
Awesome. Thank you, Jalen. So a little bit about our agenda today. So we have a case study that we're going to go over, and we'll have some questions that we're going to answer about the case study, and then you'll all have an opportunity as well to ask us questions. And then after that, we'll have a break for about 15 minutes, and then around 10:15 or so, or around maybe 10:15, 10:30, we'll start our training, which will be on the Coping CAT curriculum, which is an evidence-based curriculum for working with youth and adolescents. And then around 1 o'clock, we'll have a video activity, kind of like a virtual simulation activity for those who are in Tex-CHIP. So y'all are welcome to stay, and we'll go ahead and share the case study.
Dr. I, did you want me to share it, or were you going to share it?
I have it up. I can share it.
Awesome. Okay.
Can everybody see the case study now? Great. Okay. So I can go ahead and read it, and then Bethany can facilitate the questions for us. All right. Adriana is a 12-year-old cisgender Hispanic female. Adriana just started the 7th grade, and her parents report that they have been having trouble convincing Adriana to go to school. Most days, Adriana reports frequent stomach aches and has trouble getting out of bed in the mornings. You, the clinician, assess when these worries first started. Her parents report that since she began school a few months ago, Adriana has had some notable changes in behavior. They described Adriana as generally being funny and talkative at home, but has become more secluded around peer groups. Her parents described their family as very close and were open to a psychiatry consult if need be. When speaking to Adriana about these symptoms, she reports that she has been experiencing obsessive worrying, which causes her to lose sleep at night. These worries include ruminating thoughts about school and feeling like something bad's going to happen. Once she gets there, so feeling like something bad's going to happen once she gets there. Adriana does not know what she's afraid of. However, she notices that everyone has friend groups and people they talk to, but she has a hard time talking to other people. Adriana states that she feels safe when she's at home and has even been struggling to make it to soccer practice for her traveling team, which she has been playing since she was 8 years old. Although Adriana has been an active child, she's noticed that she gets more frequent muscle aches than before and has difficulty concentrating at school, playing soccer, and in social groups. When you assess if she gets nervous in large groups, Adriana replies, "Not really. I'm just scared that if I'm away from my home, something bad might happen." Adriana was able to identify that one time when she was in class, her palms began to get sweaty. Her heart started to race, and she had difficulty catching her breath. She went to the nurse's office where they called her mother and stated that she may have had a panic attack, which is why her parents decided to seek your services. Adriana has had a total score of 39 on the YOQ 30.2, with elevated score of 20 on the Depression and Anxiety Index, a 4 on Social Isolation Index, and a 5 on Hyperactivity and Distractibility. These scores reach the clinical cutoff, and you decide to administer the GAD-7, where she scored a 15, which is severe anxiety range. All right, so now we're at our questions.
Okay, so this is where I'll jump in, and Dr. I is also going to be our panelist. So with the first question, let me admit somebody really quick.
I think I got
it. Link. Sorry about that. I was doing that email. So for the first question, we would like to know what your clinical impression of the client is and what your first steps might be in assisting the client.
Who wants to go first?
Any of our panelists may go first.
I can go ahead and go first. So first initial clinical impression of this client is that she seems to be presenting with symptoms related to generalized anxiety disorder. As I mentioned, with excessive worrying and sleep disturbance, sense of dread, muscle aches and tensions, difficulty concentrating, things like that. Also, so she's having panic attacks may meet criteria to add the specifier for panic attacks within that diagnosis. Maybe one of the first steps I would like to do in assisting a client is just that assessment phase, things that I'm already getting questions in my mind about what I would like to ask this client. So, those things would be, I'm curious about the antecedents that may have occurred that she may have been experiencing right before the onset of the symptoms. She talks about how this started a few months or some time after starting this new school year. I'd be curious to know what had happened, what she experienced that led to this anxiety to get to this level. I'm also curious about, and maybe this gets more into as we discuss, treatment. I'd be interested to know kind of what kinds of thoughts she's having. Like, what are the themes of her thoughts? Are they like socially related? Is she becoming anxious because of her academic performance? Is there bullying going on? What are kind of related to what are those things that's happened that led, but then also what were her thoughts like that are contributing to how she's feeling, and then this the behaviors that she that's mentioned in the case study. I would also be cognizant of the of her age and her developmental stage. So, being in middle school is a tough time for everyone. I would say everyone, but I don't know. But so, especially within social relationships. And so if you even think about developmental stages like Erickson, she might fall in the identity versus role confusion stage. So there's an importance on developing a sense of self in relation to social relationships and the social context, what sets her apart from others in her peer group, you know, the importance of making friends. So all of that might play a role in what's going on. It's important for me as a clinician to be aware of that, and it would be important to ask those kinds of questions to get a full context and to help with the conceptualization of this client as we begin treatment.
Awesome, thank you.
Angela, do you want to go next?
Sure. So, I definitely agree with Jalen in regards to, her meeting a lot of the criteria for generalized anxiety disorder. But one of the concerning parts is, like, as he mentioned, like, this is all kind of new. Generalized anxiety disorder usually is at least like greater to or equal to like 6 months time frame. So all this is like new onset. Um, so I'll definitely ask a lot of the questions that Jalen, mentioned. Um, and what else? I think I would also, oh, this goes into the other assessments that I might administer. Um, yeah, I don't really have anything else to add. Um, I mean, I agree with a lot of the things that Jalen said.
Okay. Thank you, Angela. Yeah, I agree as well. And so she definitely has some kind of anxiety disorder. And just like Angela said, we really need to look to see if she would meet the criteria based off of like the specific time frame. And I don't know if that information is really given in the case study. But yeah, we would probably likely look at generalized anxiety disorder to see if she meets that criteria. She does have some social isolation. And she mentioned how like she doesn't want to leave her home. So then we would probably look at seeing if she might meet other criteria for maybe like social anxiety disorder, even like agoraphobia. But there's other criteria that needs to be met for those diagnoses. But we would definitely look in that area. And I'm not so certain that she would meet the criteria for those right now, but with a case study, you don't really get enough information. So I would just encourage you all to think about how we would further assess for that stuff. But yeah, I would probably look at generalized anxiety disorder right now. And then the panic attack is a concern, and I hope that doesn't develop any further into like a panic disorder if it happens more often. So we would look and seeing how we would look to see like how often does that occur, and hopefully we can treat that. But right now, my first steps would be first and foremost to really build rapport and make her real comfortable, because if she's never been in counseling before, or if she's never had mental health treatment, it can be really like new. It can be really scary for the first time, like having to see someone. You don't know what you can expect seeing a counselor or another mental health professional. So I want to make sure that she's comfortable. I've tried my best to build rapport with her, help her feel safe. I would want to also bring her parents in at first, just because I think that can also make her feel comfortable, kind of get to know them better, and then kind of get an idea of what they see. And so, yeah, that would be my first steps. And then I would kind of go into assessment, and then I would more than likely begin with a cognitive behavioral therapy approach. That tends to be my therapeutic approach. I also like narrative therapy a lot. So I would kind of integrate them into treatment. And then I would work on making a treatment plan with her collaboratively to see, what would be some goals that she'd want to work on. And then what would be some strategies, also with the recommendations of the family. What are the goals that they want to work on, and then what would be some objectives and strategies that we can come up with.
Awesome, thank you. I think some of these answers did touch on a few of the questions, especially number 2. So it's going to sound redundant, but if there's any other missing information that might be helpful to know.
So from my standpoint, I have like a nursing background. So I always want to think of, a lot of times anxiety symptoms, there can be underlying medical issues. So, is there any history of hypothyroidism or anemia? When's the last time she saw her PCP and had lab work drawn? I've seen a lot of people present with looking like an anxiety disorder when there's underlying medical issues. Um, and a lot of times when people take their kids to the pediatrician, lab work isn't really standard. It's like, oh, okay, everything's going fine. Oh, you have anxiety. Let's send you to the psychiatrist. But it's important to look outside of the box on my end because I have caught some things in regards to medical issues that are presenting as anxiety symptoms.
I think other information that it might be helpful to know is I wonder how her anxiety is in other environments. Is anxiety just going to school or at school? Is it other places? That can give some helpful information. Um, and then some other things that is a part of the intake, which would be, history of trauma. Is there family history of mental health, disorders and difficulties? Um, and especially would like to know how often the panic attacks are occurring, and of course what usually precedes them, if there's something that's there that influences them to arise. And because that can give us more information about treatment interventions, you know the severity of the case, what's going on. Also, what could be helpful to know is kind of the nature of her social relationships, like what's the nature of her close friend relationship with her close friends, friends at school, and also want to know what kind of grades she's making. If, for example, if she's not making the best grades, could that be a hint as to why the anxiety is occurring? Is that indicative of academic performance issues? Sometimes with children, adolescents in school, the anger or the lashing out or depression or anxiety, it could be a part of it could be that they're not doing so well in school academically. Some children have a hard time with asking for help, not raising their hand when they have a question. So they get frustrated, angry, depressed about it, and then you may see some of these things. So it would be helpful to know how she's doing in school with grades and things like that.
Thank you. Yeah, I would also just add, so there's not information really mentioned in the case study about any kind of trauma, but I'd like to know, like, is there any history of trauma? Are there other things that might contribute to her anxiety? Are there any particular events that happened? When did the anxiety really begin? Those kind of questions. And also, I'd like to know, I know this wasn't really brought up, but like, does she have any history of receiving any mental health treatment before? I just kind of generally like to ask that question to people. And so, yeah, but otherwise, everything else everybody mentioned, I support too. I think is good.
So I think that's something else that hasn't been brought up is, especially with the rapid onset of all this changes, what about caffeine use? What about substance use? A lot of these kids have been vaping a lot, nicotine. I've seen like withdrawal symptoms, anxiety related to that. Like, so substance use is really important, even if the family doesn't suspect it. And that's where the rapport comes. If you make your patient feel comfortable, a lot of times they'll end up telling you. So, I know everybody has their own approach when they're first meeting with a client. Like James says, he likes to bring in the parents at first and, make uh, have everybody together. But my approach is whatever is comfortable for my patient. So I ask my patient, you know, what would you like? Do you feel comfortable, you know, being open around your parents, or do you want to talk a little bit first and then we bring in your parents? Um, you know, because there's things teenagers aren't going to say around their parents. I mean, that's everybody. It was like that, you know. Um, so that's important too. The substance use, energy drinks, all that.
Yeah.
Okay, awesome. Thank you. So for our next question is, what protective factors did you notice with this client, and what might be some risk factors just from the little information that we have in the case study?
So some key protective factors that's mentioned in the case study, would be the close relationship she has with her family. They seem very supportive. It also mentioned that they're open to treatment, open to seeking help, and so that will be a great resource in treatment as we talk about how we can utilize the parents in helping them to support their child. And even with advocacy, if the child is having difficulty in school, it's going to be incumbent on the parents to, meet with those teachers, meet with the school counselor, see if there's any other aid that can be given to the client at school. I think her being a part of a soccer team is definitely helpful. That shows that she's athletic, she's active, um, and that she can be social, you know, and that's something I would also explore more in treatment with this client. And she's been doing it for let's say like for 4 years or something like that, so that's pretty significant. um, I think as far as risk factors, um, for me that would be the lack of restful sleep. um, that also be the avoidance. So it, a part of what makes anxiety or leads to exacerbation in anxiety is that continual avoidance. It can get worse and worse and lead to just seclusion, which will just continue to make the anxiety symptoms grow even stronger. So, and still about to answer another part of a different question is, that would be something important to target, to specifically give psychoeducation on the role of the cycle of avoidance in the perpetuation and strengthening of anxiety.
You know, like other protective factors are, like Jalen uh, brought up, she plays select soccer. So that tells me that the family is very involved and they have the money to access, you know, adequate health care. Um, and she has food and shelter and all that. So, you know, those are important because select soccer isn't cheap.
Yeah, just like everyone said, it seems like there's really good family support. So that's a really important protective factor that she has. Having played soccer is really important too. So, she had, um, some support there. And then I think she also has some more like interpersonal protective factors. Like she was able to recognize that her palms get sweaty. So she seems to be pretty self-reflective. Like she has some good self-awareness, and she was able to communicate a lot of her symptoms from the way the case study made it seem. So she has that as well. I think that she could also respond really well to therapy, being willing to talk, self-reflect, examine her symptoms, and then her willingness to come into therapy or to come into treatment is also a very strong protective factor as well. And then when it comes to risk factors, like the avoidance, I think avoidance is one of the most difficult things to treat, because avoidance just kind of naturally reinforces itself. So when someone feels anxiety because of some anxiety provoking situation, when they avoid a situation, they feel a sense of like short-term relief, and that short-term relief then reinforces that behavior of avoidance again. And so that's a risk factor that I worry about, leading to social isolation. So I would definitely take a strong focus in that area as well.
Thank you. So moving on to our fourth question, regarding your professional expertise, what treatment approaches might you use to assist this client? I think we touched on it just a bit, but if we could elaborate a little bit more.
So my primary focus is medication management. And just because somebody comes to see me for an initial psychiatric evaluation, that doesn't mean I'm automatically putting them on meds. You know, we have to weigh the risks versus benefits. Does this patient really need to be on medication? Or do I need to refer to a therapist? Or do they need both? Um, so that's, one of the things, first line treatment for anxiety is SSRI medication. So that would be a big one with me, is medication management.
I think with treatment approaches, definitely, CBT would be a fit for this client. I've already mentioned I'm already curious about the themes of her thoughts and how that can give uh, information as to what's kind of the underlying causes that are leading to these feelings of anxiety. And just the helpful skills that come with CBT. I think that would definitely be helpful for this client. I think also skills training type of things, if the client is having difficulty with socializing, with expressing feelings, with asking for help, utilizing skills training in session could be helpful. Things like, and also role playing, and rehearsals, just any, of course, with all the things I mentioned, whether that be asking for help and trying to make friends, things like that. We can rehearse those things in session that, could help them learn those skills and lower that, hopefully help lower that anxiety for when they need to use those skills. And then I've already kind of talked about the wanting to target the cycle of avoidance, and we've mentioned just why that's important. But then also learning helpful emotion regulation, relaxation skills. Maybe some particular ones that immediately come to my mind. I'm at the end tail of a EMDR training, so I'm going to be EMDR trained soon. And one of the interventions that we learned that I think would be really helpful for this client is called Safe Calm Place, which essentially is just utilizing guided imagery to help a client construct this safe, calm place that they can call upon, return to in the moment in which they're distressed. And then you're using the bilateral stimulation to install that, to make that easier for her to call upon that when she needs it. Also, container, which is another intervention for when a client is just completely overwhelmed. They can imagine putting whatever is making them overwhelmed in this safe container that can only be opened by the client. And that will be helpful for lowering, in this case, lowering the anxiety in that moment. But then also when the client comes to see me for therapy, we can open that container and process what she put in there, So I think those things would be helpful in working with this client.
Thank you both. Yeah, that's great. I really enjoy CBT. I think it's very helpful. And just some things that stand out too that I should mention is like when clients are struggling with anxiety, they're often in a state of discouragement. So they feel like, if I go and, go to school, like for example, like if I go to school, something bad might happen, or, a lot of kids that have social anxiety, if I go to school, then I might get criticized, so I really would want to, first and foremost, really build that rapport, and really be encouraging. And so we talk about person-centered therapy, being empathic, genuine, having unconditional positive regard, really try to promote a safe environment. Then with CBT, the emphasis is to help them understand the relationship between their thoughts, their feelings, and their actions, right? And so I would really like to first begin teaching a client relaxation techniques. So kind of like what was mentioned already, deep breathing, progressive muscle relaxation, visualization, relaxation techniques, just so that they know how to regulate their emotions, and recognize, the bodily signs and symptoms of anxiety, and then knowing how to produce a state of relaxation for themselves, so that they can manage. Then, we would then probably focus a lot on cognition. So, what are the common thoughts with anxiety? So, she may have thoughts like, if I go to school, something bad might happen, right? So just to try to kind of understand how those thoughts are responsible for those anxious feelings, and then, really explore them collaboratively. And then there might be some techniques where we look to examine those thoughts to see, are those thoughts really helpful? And are those thoughts really true? So like some strategies might be like catch, check, change, catch the thought, check the thought. Is the thought helpful? Is this thought true? And then work on changing it. And another activity I like to do is like taking it to court, where we really examine the evidence as if we're in court to see, like, is this thought really true? Like if you go to school, do you have, supports who you can go to help you? Do you have people who can talk with you? Do you have resources at school? So that she can kind of challenge the thoughts like, oh, you're totally helpless or you're totally unsafe. So kind of work on that. And then I also really believe that systematic desensitization is going to be helpful, to help also like work against that avoidance. So going places like, so if she feels uncomfortable leaving her home, maybe building her up to be comfortable leaving her home in less anxiety provoking places and situations until she can be stable with using the coping skills that she's learning. And then, that natural resistance in people and resiliency in people can help them kind of, reach a certain state of, comfortability and relaxation. And then we scaffold it up to the next place that might be anxiety provoking, like going to the mall or something, or going somewhere where maybe not be as busy, but then look at like when it might be a little busier, and then we can kind of slowly scaffold our way up, while she's learning relaxation techniques and strategies, so that she's desensitizing herself to these situations. And we can even do this in a school setting. A lot of times when children struggle with anxiety in school, they'll begin not by just introducing them back into the regular classroom, but maybe they'll go into like a SAIL unit, or they might go into like one classroom and they might stay there the whole day until they gradually start going to more classes, until eventually they're back at going to their usual class schedule again. So kind of working with the school a little bit and doing that. And then I really like narrative therapy. Narrative therapy emphasizes the importance of like story and language. Language is like the framework of meaning, right? And in narrative therapy, we try to externalize the problem from the person. So we might talk as if like, oh, like, what's it been like since anxiety shows up? Like anxiety is kind of like an uninvited guest, right? Kind of like we're externalizing it from her, trying to get the story of how anxiety started to affect her, and map out the effects that it's had in different places in her life. And then kind of also at the same time, get the story of the times when anxiety didn't show up, or anxiety wasn't around, or anxiety didn't keep up with her. And what does that say about her? What does that say about what she's capable of in those moments? And what does that say about what's important to her? So we would kind of like get the story of the problem and then the story of when the problem wasn't there, and kind of build a narrative to help her recognize how she's a lot more than just what anxiety tells her about herself or about her situations, you know, and to help build her sense of confidence and her ability to overcome and withstand anxiety provoking situations, all through the use of story and language, which is like a deep cognitive therapy. I kind of gave a jet tour on that, but that's those are the approaches I think I'd take on that.
I also want to add, just in hearing the answers and thinking more about what would be helpful for this client, I think it'd be important to give psychoeducation on anxiety. Particular, anxiety can be looked at as just a nervous system response to a perceived or imagined threat. Really, we can, and this maybe get into more of a compassionate focus or orientation, which is, your body and your nervous system is just trying to protect you from something that it believes or that you believe or feel could harm you. And, evolutionarily, that's been helpful, right? But in some cases, especially in this case, maybe the anxiety can be just based on something that isn't an actual threat to the client, but it can be important to teach the client, to give the client that information for us to talk about it and to look at it in this sense that, and there's some actual interventions on this and using that compassionate focus or approach. I've used it with a client where, we in our adaptive responses in CBT, we may acknowledge the anxiety and thank it for trying to protect us, but also say, you know what, I got this. This won't harm me, but thank you for alerting me to this concern. And then also, it's important to know that anxiety isn't, and maybe this is just in general culture, or just what we kind of just naturally think, but because it's distressing, because it's an unpleasant feeling, that anxiety is a bad thing and that we must get away from it. But we really want to learn how to tolerate anxiety. So in these interventions, especially with desensitization, we need to be able to build up tolerance to anxiety, because otherwise we would just want to simply avoid it, which is impossible really in life. There are things that are going to make you anxious, but just because you're anxious doesn't mean that, if I'm feeling anxious, something is wrong, and so I think it's important for clients to learn, especially when treating anxiety, that there's an importance on, yes, we can learn how to lower the distress level, but also to increase the tolerance for anxiety.
Yeah, exactly, Jalen. I agree with you about that. A lot of times people think, oh, I'm experiencing anxiety. Yes, maybe it is your body saying something is wrong, but it's a normal response, just like feeling sad and mad and all these things. People think that they're just supposed to feel comfortable all the time. And that's not realistic. So having like realistic expectations, um, but anything in excess, yeah, it is a problem. Like in her case, it's affecting her day-to-day life. So then it does become a problem. But sometimes I find when I'm reassessing patients after being on medication, they're like, well, yeah, I'm still feeling anxiety. My medications need to go up. And it's like, wait, wait, wait. Having feelings is normal.
Thank you. Okay, so moving on to the fifth question. What might be some other potential assessments that you might administer, if any?
So one of my go-tos is, well, I definitely like GAD-7, which was already done, but PHQA, depression scale. a lot of times anxiety and depression, they kind of overlap. Um, and something we didn't bring up earlier is like any suicidal thoughts, any self-harm thoughts. Um, so it's important to do thorough assessment, not just focus on just the anxiety.
I agree with what Angela was saying. PHQ definitely want to assess for depressive symptoms. They do go hand in hand a lot of the times. Um, and other than the GAD-7 that was mentioned, I would I don't know if this counts as an informal assessment, but I would really like to know what the teachers are seeing in the classroom with this client. Has the parents talked with the teachers about those things? Are they noticing, well, not only about changes in grades, they would know about that, but also are they noticing like isolation within the classroom? Um, she's quiet, doesn't really ask for help, keeps to herself. Like what is she noticing in the classroom with this client? And then has she spoken with the school counselor? Has she that goes into the asking for help or the other resources that are available at the school? Is she taking advantage of any of them? Have they been offered to her? Um, but that's just some of the things I'm still would be curious about. But other than the formal assessments that were mentioned, can't think of anything else.
Yeah, I'm really glad that Angela brought up assessing for suicidality. That's really important, especially because she does have depressive symptoms. And with like a lot of community agencies, it's required that we assess for suicide risk for anyone that has a depressive disorder. And so I kind of make it my practice to still do that. So there's the Columbia Suicide Severity Rating Scale, which will help, determine if there's any current risk or any history of suicide attempts or ideations, which then would prompt you to go into safety planning. And so that would be important. And then I really also like just personal interview and family interview, gathering information that way, I think is really important. Just as part of just the whole assessment process. Assessment is just always an ongoing thing for us. And then more like formal structured assessments, I definitely, like the GAD-7, the PHQ-A, the PHQ-9. I like also the Beck Youth Inventories, particularly the Beck Anxiety scale for youth. I think that's a really great one. There's also a lot of great DSM-5 measures that are valid and reliable measures. So there's like level 1 where you assess the kind of whole gambit of like mental health functioning. And then there's level 2 measures that are specific to symptoms and specific to diagnoses that help you justify your diagnosis. So I like a lot of the anxiety scales in the DSM-5. But my go-to typically is the Beck Youth Inventory. I also like the Brief Symptom Inventory, which is also kind of like a battery of assessment that assesses for overall mental health functioning with particular subscales. And then I like to focus on that anxiety scale as well, since she really presents high anxiety. And then I like a lot of positive psychology measures too, because there's a lot of strengths in our clients, and helping assess for those things can help you identify protective factors and also ways to strengthen your treatment approach. So I'd assess for other things later on, like hope, resiliency, grit, life satisfaction, those kind of things. And then when you assess for those things, they recognize, wow, those constructs are within me. Like I do possess resiliency, or I do possess grit, I do possess this and that. And I think that can help really complement, your treatment.
Awesome. Thank you all. Okay, so for our sixth question, and I think this was also kind of talked about, if you were caring for this client as part of an integrated healthcare team, what would be your role and responsibility to the client?
I mean, at the top of everything, not doing any harm. Sometimes I feel that when I have teenagers come in, parents can be very like pushy, like, no, they need to be on medication. And it's important to remember that just because they're adolescents, it doesn't mean that they don't have a voice. It doesn't mean that I just listen to everything that the parents say. Yes, that information is important, what the parents are saying, but it's not everything. And so sometimes I think there's providers that um they maybe side more with the parents. Uh but it's important to pull everything together to make the appropriate decision and the safest decision. Um, not letting parents bullying you into what they want for their child, because sometimes what they want isn't always the best option.
I think my role, as a therapist, and I'm kind of going to be answering specifically from at my time when I was at MHID, where I was in that integrative, environment. That I would definitely need to keep my notes up to date for this client, as she is seeing her other providers, case managers, psychiatrists, to make sure that they have the most up to date information, should they need to look into the progress of the client in their therapy, are they attending and they're taking it regularly, and how are they doing. Um, I would want to know what meds the client's on, so there'll be times where I'll look and see what were the current medications, but also if the medications have changed, it'd be important for me to know that, because if there's a change in symptoms, a change in mood and all that, I need to know what will account for that. What's especially as I'm tracking treatment with this client and how our interventions are affecting the client, helping the client. What are the other factors that could be contributing to that? So I would definitely need to know that. Some clients, depending on the severity of the anxiety, are maybe placed on benzodiazepines. I definitely need to know that. Maybe something more specific in regards to that. And you might hear about this more in trauma work, but sometimes taking a benzodiazepine before session, keep in mind, when we're working to help them regulate, when we're helping them to build their tolerance, sometimes taking a medication like that before session could be counterproductive. And we would have a responsibility to bring that up, especially, as I said, more specifically with EMDR. I know this isn't a trauma client, but you can use EMDR for anxiety and depression, things like that. The idea of EMDR is to help them get activated so we can help them process. So if they're taking a benzodiazepine, that's going to inhibit that processing that would need to occur. But also in the context of anxiety, if I'm teaching these skills, but they're taking a medication like that right before session, what we're trying to get them to learn and integrate, it might hit a roadblock because of that. So it'd be important. That's another reason why it'd be important for me to know what meds they're on, and how that could impact treatment and also the tracking of progress. And then it's important for me to be in communication with her other providers around her, for the same reasons I talked about, how I need to keep my notes up to date so they can know what's going on. I want the same for them, and at MHID, we're able to consult regularly, discuss ideas of what would be helpful. And so that was always a big help when I was seeing clients there.
Oops. All right, thank you all very much. My experience at MHID has been very much like Jalen's. I feel like it's really important that clients feel like they can communicate to medical professionals. Sometimes they just feel intimidated or they don't know what to say. And so helping advocate for them sometimes is good, and really like taking the time to say, okay, what is it that you want your medical provider to know about your symptoms, and what would you like them to know about how the medications have been supporting you, or how would you like them to know how the medications might be like causing some side effects. And I want to encourage them to communicate that to their medical provider. So if I can be some kind of medium of that, like to help them communicate that'd be really important. Sometimes we were in a role where we had the responsibility of educating them on the role and functions of their medications, but I typically would rather have a medical provider do that. So I would really kind of have them, get the opportunity to talk about that in session with their medical provider. Sometimes we'd have the opportunity to be present in session while they're talking to their medical provider, which was great in a setting like that. It's not like that in every setting, but if you are working in the same building with a medical provider, it's really important that you have time to speak to them about your client, to staff cases and let them know how things are going. Because like I said, a lot of times clients feel intimidated and they report to them, oh yeah, everything's fine. I don't have any problems, like the medications are working, but then in session, they tell you the complete opposite. So there has to be that honesty and transparency. And so I feel like it's my responsibility to, bridge that, and communicate to the medical providers about what's going on, and also keep them up to date about things that are happening, things that are going on with the client's life. So a lot of staffing, a lot of collaboration, I think is really important. And then also, sometimes as counselors, we do some linking, some coordinating of other resources. So maybe there's other medical needs that they have. Maybe they don't have a PCP, help them, find one. So I know that's kind of like more of a case management role, but sometimes like if your client doesn't have a case manager and they don't know how to utilize certain resources and they need medical support, link them to that stuff.
Okay, so that brings us to our final question. What outside resources might you recommend for this client?
What may also be helpful would be if there's skills training groups offered in the community, especially given if in session as we're conceptualizing and gathering information, if there is a need for learning how to communicate with others, make friends, express feelings, ask for help, things like that, that if there's groups out there for this client to join and participate in, that can be just supplemental, that can be helpful for the client. And then also, of course, that social aspect of, being around others, talking with others, getting to know others, interacting. I think I would just encourage this client to, hang out with your friends. Has that decreased? Hopefully not. Continue to do that. That can help decrease the isolation. Keep them active. And hopefully, if she has a soccer team, that she's not only hanging out with some of those friends at soccer, maybe she can hang out with some of her friends elsewhere, maybe invite them to her house, and then also it would encourage, are there any other sports that she's interested in that maybe she can get into? Then she can already be utilizing that athletic and active side of her to get into something else that she's interested in, which will just lead to meeting new people and forming new relationships. And that could be helpful as well. And then, of course, if she meets criteria and it's a need, then go to MHID, just you're gonna hear that. We've been saying that a lot, but if clients there would have that case manager, would have that psychiatrist if needed, would have that counselor if needed, and that'd just be another place where they can get all those helpful services in that integrative setting.
I was just gonna say too, so referral to a psychiatrist or psychiatric nurse practitioner or medical provider. I would also like to collaborate with the school counselor, just to kind of keep them informed about, what my role would be. And of course, I'd get the consent from the parents to speak to anybody else, but I think it'd be important to see if we can support her at school, because that's where a lot of her anxiety, occurs. So I'd try to collaborate with the school administration and the staff there. And then I'm thinking like also like Big Brother, Big Sister program could be helpful, because while yeah, maybe she has friends or maybe not, I know she tends to want to isolate, and so maybe encouraging her to do things outside of the home where she can still feel safe. Or where she can still feel, supported. Now that could take time. I mean, introducing someone like a big brother, a big sister, might be a little scary. So maybe something like that where she could at least start to feel more comfortable and more prepared to then do things in the community, to be more involved, to be more active, to have someone who she feels, she can talk to and confide in and support her. And I'm hoping, yeah, as a counselor that we can be a part of that too. Um, and yeah, group therapy I think could be really good. And then just any other like outside resources, activities that she can be a part of. I think anything that can prepare her for overcoming anxiety provoking situations can be good. I'd also want to see like does their family go to church, or do they have any faith-based organizations around that maybe they feel like supported by. I'd want to understand their culture better too, to sort of kind of understand that, and if there's any resources that we can link them to. So that kind of comes to mind. We have some time then, for questions, if anyone in the group has anything, or if anybody in the panel wants to add anything. Anyone in Tex-CHIP have any questions for us? We answered all your questions.
So specific to treatment, one point was made like checking in physically as far as hormonal, medical, physical issues. So I wanted to know how, like, would medication management for anxiety overlap with the hormonal or medical treatment, or would you first like chicken or egg? Like do you first attack like medical treatment, and then if the anxiety still there or like coexisting alongside like the symptoms, I guess, then do you go into medication management for anxiety? How would that work?
So personally, when I've been in this situation, a lot of times, the patient has been struggling with, let's say, anxiety for a long period of time. So a lot of times I will treat the anxiety because they're still feeling that. They're still feeling that, and a lot of times, sometimes people they don't have a PCP. So how long is it going to take for them to see a PCP? Months. Um, So I would most for the most part, I would probably be treating the anxiety and still referring to PCP. But that's not every situation. Um, but I would say for the most part, I'm still treating it because a lot of times, even when I do send them to PCP, sometimes everything is okay medically. And if I was to not treat the anxiety, that's kind of prolonging their suffering. Did that answer your question?
Yes, thank you.
And Kendall, I think it's also important for, especially for our younger patients, to know that just because they get started on medication, it doesn't necessarily mean that it's going to be forever. Um, a lot of times I like to explain it as, okay, somebody with high blood pressure, are you going to tell them to just get over it? No, maybe at first they get some medication, they make some lifestyle changes, and then in the future they can get off of the medication. And it's the same thing with like anxiety and depression. Maybe they're going through a really hard time in their life right now. They need the support of the medication temporarily, and in the future, uh, after they make some lifestyle changes, such as going to therapy, if they want to talk about getting off the medication in the future, that's something we can do.
Thank you.
I wanted to add something else that came to mind. Um, as I'm thinking about treatment, with children, adolescents, you gotta meet them at their level and use other means, that will specifically may work better for them. And what comes to mind for me is, in getting to know the client, coming up with some games for them, feelings, just some, there's like a ball that has like different questions on it. You can throw back and forth and answer, and that helps them, of course, to build rapport, but it's 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 helping them to tolerate and even overcome the initial anxiety they have in meeting a new person. And using yourself and that relationship as a means of treatment. So you might ask, as they get more comfortable with you, just uh, you might ask things like, how was it for you to get to know me and to meet with me? You were anxious at first, but how are you now? And have them reflect on that. And because we are someone new to them, they're anxious in coming in, they're having to um, speak, with you. Maybe not at first, they may not speak as much, but over time they speak more with you. So reflecting on that and how they became comfortable with you, and what skills they used, with you, and becoming comfortable. So that's something that jumped out at me, that I remember, that using yourself in the relationship in that way could be helpful.
Yeah, Jalen, a lot of patients when they, first meet me, they're super nervous, but by the end of it, I feel like they're able to like breathe, like, oh, okay, you're not so bad. So sometimes I'll joke with them, well, I wasn't as bad as you thought I was, right? And for the most part, the flow goes well after the first visit. Sometimes it's not like what they're expecting. I think there's a lot of, stigma. They think about, a lot of times I have young patients come into me and they're like, "Oh, I thought you were going to be some old man," and it's just not the case. So a lot of their worries are alleviated after they speak with us and they feel a little bit more comfortable.
Thank you. What about anybody else? The last minute question. Anything come up for the rest of our students?
Well, if not, then thank you all so much, Angela and Jalen, for serving on the panel today. I really appreciate it, and you guys really helped us out. So thank you very much. And so we're gonna go ahead then and take a 15-minute break. We'll come back like around 10:21. No, that's not right. 10:26. 10:26, and then we'll begin. Let's just say 10:30. We'll come back like around 10:30, and then we'll begin our training on the Cope and CAT curriculum.
Bye, everyone.
Bye.
Thank you
Thank
so
you.
much. Bye.
Bye.
Thank you.
Okay.
Okay. So what I'll be talking about today is the Coping Cat curriculum, which is a curriculum primarily used for young children, but I'll also talk about the curriculum that's used for adolescents, which is the CAT project. They go really well together. They go hand in hand, and they're both created by Philip Kendall. And so young children can be as young as 5 years old. And you can overlap the ages for adolescents. So you can use the Coping Cat curriculum for clients that are 12, 13. You can even use the CAT project with clients that are like 11, 12, all the way to 17, or even with adults. So we'll be talking about that, but I first want to just begin by asking you all, and I need to resume. Oh, I did resume recording. Great. I wanted to ask you all a little bit more about anxiety. So with anxiety disorders, let me just kind of share that the DSM-5 talks about how these are disorders that share features of excessive fear and anxiety related to behavioral disturbances. So what do you all think the difference is between fear and anxiety? How are they different?
I feel like fear can be more of an actual emotion, and anxiety can be looked at as a defense.
Yeah, thank you, Asia. Very good. One thing to consider too. Well, does anybody else have anything they wanted to add? How is anxiety different than fear?
I was thinking, oh, sorry.
Go ahead, Esther.
I was just gonna say, for me, the way I conceptualize it is like fear is like something that you're afraid of that might be like in the moment, but anxiety is more of like an unperceived thing that might be like in the future, like the past.
Very good.
Yeah, I see anxiety come up more with like trauma, like as a trauma response.
Right. And I want to put this in, and Ashley, were you going to say something?
Like exactly what Esther was going to say.
Yeah.
Yeah.
Very cool. I'm going to put this in the chat. So the DSM-5 says that fear is the emotional response to real or perceived imminent threat, whereas anxiety is the anticipation of future threat. But they both occur at the same time often, right? And so the one thing to consider here is real or perceived threat. So what would be a real threat in which fear is appropriate? Like if someone's life is in danger, right? What would be an example of a perceived threat that still gets the same emotional response, but someone's life is not necessarily in danger?
Maybe the fear of failure.
Yeah, right. Because that could be devastating for someone if they anticipate, or if they feel like they failed at something. That could be an awful thing, because that has so much meaning to them. It's so important that they don't fail, and if they fail, then that's awful. So notice how sometimes people's bodily reactions and symptoms are similar. So what typically happens to our body whenever we are experiencing a real or perceived threat? Like if you're outside and all of a sudden a dangerous wild animal comes charging towards you, what will be your reaction?
Like a physiological response would be like increased heart rate. Maybe you feel like an adrenaline rush, and so excessive sweating will come into play, like to fight or flight.
And I'm sorry, I tried to leave my dog outside, but she came in, she might be barking. So I think she's gonna, I might have to set her out. So I apologize. Can y'all hear her barking? No? Okay, good. Hopefully Zoom filters her out. Okay, yes. So there's a fight, flight, freeze, or fawn response. And some people even faint, right? So yeah, like we typically will have our, heart start beating fast, our pupils will dilate, our muscles will become tense, and we'll either want to run away or we want to fight to protect ourselves. And what's very interesting is that sometimes in other situations that we perceive as threatening, we'll have the same somatic physiological response, right? But let me ask you all, is your life in danger if you're having to go to school to give a speech? Let's say you have a speech you got to give or a presentation. Is your life in danger? Not necessarily, right? Yet we could still have the same bodily response and reaction. So it's really important that we educate, our clients on the differences there. So I really wanted to emphasize that. So before I jump into the curriculum, there are some basic essential things that are important for clients to know and learn about. And it's really important that if you're going to be doing a CBT curriculum, that you teach them the cognitive model. And so I'm going to have you all in a little bit get into a breakout room, and I'm going to have you all teach your partner about the cognitive model for a second, but I'm first going to share it with you. So some of you, I know you've learned this before, but I just really want to emphasize how important it is, and even coming up with other innovative ways to educate a client on it. So can anybody first tell me, like, what is the cognitive model? Like, what are essentially the characteristics in the cognitive model? Some of you may have heard it called the personality triangle as one way to educate on the cognitive model. What is the personality triangle?
Our thoughts, feelings, and behaviors are all connected and influence one another.
Excellent. Yes. So what I would recommend is that you have some kind of visual aid. So you would have something like a dry erase board with you. If you don't have a dry erase board in your office, maybe get one, get a portable one, possibly if you do home visits or if you go to do school visits and things like that, because it could be very helpful. Or carry with you just blank paper with markers and kind of draw this out. This is going to be really, really helpful. So it would look like this, right? And my draw, okay, I have kind of like new things on this. So this is kind of what it'd look like, right? We have the triangle, and we would help them understand the relationship between their thoughts, feelings, and actions. So what I also like to show is how, like Ashley said, how they're all connected, how they're related, right? Is it easy for us to feel anxious if we're having thoughts like, I feel safe? Do those really work together if that's the case? No, right? So you notice that there's a holistic experience between our thoughts, feelings, and actions. So whenever someone is feeling anxious, they typically have thoughts that might be responsible for those unpleasant feelings and emotions. And then their actions also would relate. So what are some common actions that people have whenever they're feeling anxious?
Avoidance.
Avoidance, yeah, definitely. Avoiding the perceived threat or anxiety-provoking situation. What other actions do people have? What about like their bodily responses and reactions?
I was thinking rumination, but that might not be so much of a bodily response, but similar to that of worrying.
Very good. Yeah. So sometimes we anxietize, like some theorists conceptualize all of this as behavioral. So even our thoughts are behavioral, right? So we are anxietizing by ruminating. You know, that's kind of like an action we keep on doing, distinct from other actions with the body. We do it with the mind. Okay. So yes, ruminating on things. A lot of times that's kind of what we see with clients that have maybe obsessive symptoms. Like for example, they might be anxious that their significant other might break up with them. Like I met with a young man, you know, at juvenile detention in another county yesterday, and he was so anxious because he was anticipating that his girlfriend was going to leave him, and he kept obsessing over it and ruminating on it, and it was causing him a lot of distress, and it caused him to be really irritable, and had difficult times with the staff, you know, and so it made things a lot harder for him. So they go hand in hand. So it's really important that you educate your clients on this and use visual aids, and young children can understand these concepts. What would be some examples that would be good to share to fill this in with, for young children to understand? What are common thoughts young children have who experience anxiety?
I would say like abandonment, or like almost like reactive attachment to the parents, like the parent leaving them or just not being present.
Okay, yeah, let's do that one. So there might be thoughts like, my parents might leave me. Now, the thing to consider, this is where we have to be really careful in how we listen to our clients. And this is a really important part with CBT, right? There's different levels of thoughts. So I should probably share here on the left-hand side, we have our automatic thoughts. We have our intermediate beliefs. And then we have our core beliefs. And this takes time to really develop with a client. It's kind of like you're getting to peel the onion. You get deeper and deeper to the core beliefs that they have. But typically, automatic thoughts are like the first thoughts that come to mind. So if they hear that, okay, you got a new school season starting soon, you know, or we got to get ready for school next week, what might their automatic thought be? Typically, automatic thoughts are like one word, quick reactionary thoughts. It could be this one. My parents might leave me. I might be left alone, right? I won't be with them. They're going to send me somewhere, right? Usually it's like, oh no. What might the intermediate belief be? And by the way, intermediate beliefs typically are rules. They're rules like, if blank, then blank. And this is where you got to kind of use your counseling ears to listen to this stuff. What might they say? How might they fill in that sentence, knowing that their automatic thought is, my parents might leave me?
If my parents leave me, then I am not safe.
Excellent. Very good. Yes. If my parents leave me, then I'm not safe. Now, this will take time to develop, maybe several sessions, but eventually you'll kind of figure out that they have these rules that they operate by. They have rules about themselves, they have rules about people, and they have rules about the world and other situations, right? So we see that they're operating by this rule of, if my parents leave me, then I'm not safe. So what might their core belief be about school, or about the world, or about being left alone?
In general, that they are not safe, like out in the world, in public, or at
Yeah.
school.
Maybe
the
like
world is dangerous.
the world is not safe. Or maybe there are specific beliefs about specific places. School is not safe, right? So this is important to kind of understand and see kind of where they're coming from and how this kind of develops. So I also am going to share with you all how I like to introduce this story of how I like help clients see the significance that thoughts have. I'm trying to learn this new share screen thing. Okay. All right. So let's see, where's draw? Sorry, that's not what I wanted to do. Let me stop. Let me try it again. Okay. So I like introducing this to young kids, and some of you have seen this before, but it's where we give an example of an anxiety-provoking situation and we draw it on the board. I like to do a roller coaster example, but does anybody have any other example that they like to do or that they tend to do when it comes to introducing some of these concepts? Well, let's do the roller coaster example. So how many of you like going on roller coasters? Some of you do, okay. Some of you may not be comfortable, right? So I like to share a story with kids about these two kids called Mo and Joanna. So this is Mo and this is Joanna, and I'm not the best artist on Zoom share screen, but let's just say this is let me do a better one. Okay, so, and I would probably be doing this on like a dry erase board marker. Let's say this is Joanna. So she is got this big expression on her face, right? And this is Mo. Okay. And this is a roller coaster in the background. They're waiting in line for the roller coaster, okay? And here you've got, you know, some people on the ride. So remember the triangle we had drawn, right? What do you suppose Mo is feeling? What do y'all think? Anybody want to guess?
Scared.
Scared. Scared, fear, right? Well, how can you tell? And imagine now you're a young child. If I were to ask you, how can you tell Mo is feeling scared? What would you be able to, what would you be saying?
The sweat and open mouth and eyebrows.
Mm-hmm. Right. And here's where you might describe other somatic responses and reactions: heart beating fast, sweating, the facial expressions, right? Eyes are wide open. Maybe they're like their eyes are like real big, you know, like what do you suppose Joanna's feeling? Waiting in line for the same roller coaster.
Excited.
Excited. How can you tell?
Big smile, big eyes, open body language.
Right. What do you suppose Joanna's thinking?
I can't wait to get on that roller coaster.
I can't wait to get on, because if I get on, then
I'll have some fun.
I'll have some fun, right? So there's different rules that she's operating by. What about Mo? If I get on, then
I'm gonna die.
I'm gonna die. I could get really hurt, right? And so there's clear anxiety present. There's this anticipation that something bad's gonna happen, and it's focused on this situation, and they feel very uncomfortable and unsafe. What do you suppose that Joanna can say to Mo to help Mo be a little bit more comfortable on the ride?
There's seatbelts.
Hey, there's seatbelts. Did you know that there's seatbelts on the ride? Good. Okay, so seatbelts thinking about seatbelts, what comes to mind when you think about seatbelts? What words are associated with seatbelts?
Safety.
Safety, right? Yeah, so that's one thing. Hey, there's seatbelts. So we'll be strapped in, we'll be secure and safe. What else could Joanna share with Mo?
This might be more like seatbelts, but there are guardrails in front of you
Yeah,
that keep you secure.
right. Not only do you have seatbelts, but you got like guardrails, you got sometimes chassis that come over you. And then even like with the tracks. Okay, anything else?
It's temporary.
Temporary, yeah, it doesn't last very long, you'll get through it. Some other things I like to share with clients in this example is like to say, hey, look at the other people who get off the ride. Looks like they had a good time, right? Maybe Joanna said, hey, I've been on this ride before and I've enjoyed it. Look at the other people having fun. I'll ride with you. We'll go through this together, right? This ride has been in operation for a long time and it's very safe. Really smart scientists developed this ride who understand physics well, like maybe something like that, right? Do you suppose that if Mo really considers some of those things, some of those reasons, and listens to Joanna, do you suppose Mo might be a little more comfortable on the ride? Yeah. So what's changing about Mo in this example?
He's more willing to engage in something that is scary,
Right.
avoiding it.
Right. So that shows some of his character, right? That he's brave, that he's willing to stand up to and face adversity, right? And challenging situations. He's got some resiliency in him. So those would be good qualities to highlight about Mo as you continue the story, right? And so that could really, really help. So I wanted to emphasize how using visual aids and using simple stories and examples can go a long way and can be really, really helpful with that. So thank you for doing that with me. So I'm going to clear this, and now I'm going to go ahead and I'm going to share the Coping Cat curriculum. Can you all see it? Does it come up? Okay, awesome. Very cool. All right, so like I said, the Coping Cat workbook has a sister copy, which is the Cat Teen workbook, which is this one, the Cat Project curriculum. And Philip Kendall is the creator of both of them. So I'm going to be switching back and forth sometimes, but I'll be probably focusing more on the Coping Cat workbook. And we have this workbook in our office in Tex-CHIP. So you all are welcome to come by and pick it up. I know it was kind of last minute and I apologize. Please pick it up so that you can apply this with your clients in your sessions. So it begins where they have their own workbook, which would be one like this, right? Now, if you don't want to give it to the client themselves, at least make copies for them each week so that they have some and have some ahead of time. There is a therapist manual that also helps you and guides you throughout each session. So that's also very, very important. So here are the table of contents. And I want to first emphasize too that curriculums are not meant to be rigid code books, okay? They're not meant to be rigid code books, but they're open for you to serve as guided templates that guide you throughout your treatment. You can, and Philip Kendall mentions this, you can supplement your own approaches, your own worksheets, your own theoretical, strategies. You can approach this curriculum that way. So it's not a rigid code book, okay? But first thing we got to do with young children is kind of get to know them, right? And so going over everything I just showed you today, I typically do that the first session. But then I introduce them to the workbook. And so you've got these are the sessions as it's outlined. This is a 16 session curriculum. and you can repeat sessions, so you can go longer if you want. First one again is introduction. You introduce yourself. This is really important because if they don't know you, they don't feel comfortable. They don't feel like they are, you know, safe, then this isn't going to be helpful, right? So you want to, first things first, build rapport, and help them feel comfortable. Then you got recognizing feelings. We'll talk all about how we do that beyond this curriculum. We'll talk about how the body reacts, the bodily signs and symptoms during anxiety-provoking situations. We'll go in more depth on that. There's parent meetings, and the children don't have to come to the parent meetings. So it's just a meeting with the parents to help them gain, awareness on how to help them navigate anxiety-provoking situations. Then there's relaxation techniques that they learn. And I like introducing other relaxation techniques beyond what's in here. And then there's a big focus on cognition and what they're thinking and recognizing their thoughts during different anxiety-provoking situations. What should I do? This now comes down to the actions they can take, right? And there's really cool acronyms that they learn to memorize for them to know how to react and respond to anxiety-provoking situations. How am I doing? Parent meeting again. Then they start practicing more and more practice. And then we're starting to develop a system where they experience systematic desensitization, where there are going to be situations with situation cards that we use, where the situations become more and more anxiety provoking as they apply more and more coping skills to deal with these situations better, so that they're more prepared. One thing I want to say that's very important is that the opposite of anxiety, the opposite of this anticipation of something bad happening, is being prepared and being well planned and knowing how to deal effectively with anxiety provoking situations. Wouldn't you say that's true? If you feel unprepared for a situation that you anticipate, do you feel anxious? We typically do, right? When you feel prepared, do you feel anxious as much? Not as much, right? You feel less anxious because you're more prepared. And so we want to help them know how to prepare themselves for anxiety provoking situations. Okay, so there are a table of contents that include stuff like a bank, which is like for rewards. And it's like a system where they can earn certain tokens, and by getting so many tokens, they can earn a reward, because we want to positively reinforce pro-social behaviors of them using their coping skills to deal with anxiety provoking situations. There's a reward menu where we list the things that are special for them. So let's just look at them real quick. So I'm gonna go to page 73, which is in this one. Here is the reward menu. Okay, so this is what it looked like, where they will spend some time in the beginning with you. This is where you get to know them better, right? They spend some time in the beginning listing rewards or things that they like to do, things they like to have, places they like to go, people they like to spend time with, okay? So let's think about this for a second. What are some appropriate rewards and what would be inappropriate rewards for their positive efforts in session and using their coping skills? What's like maybe inappropriate rewards?
Money would be an inappropriate reward.
Okay. That's probably that's a really good topic too to discuss, because sometimes that's all parents maybe know how to reward their kids with, right? And then there might be this expectation that, hey, like I am supposed to get paid for this, right? All right. Any other inappropriate rewards?
So just so I'm understanding correctly, this reward system is between parent and child, or this is between parent and therapist and child?
Great. I like that question a lot. So it is important to have a reward system between parent and child, and it is also important to have a reward system between therapist and client. Now it's going to look very different. Typically, reward systems from the therapist would be time we spend doing different activities, like playing games, trying to make it therapeutic though. And the intention behind it is to motivate and reinforce their engagement and their efforts, working through their anxiety. And then in collaboration with the parents, you can think about other appropriate rewards. but like at the end of session, playing a game of Uno can be really rewarding. Or even if you have other games like chess, or even like a Nintendo Switch, but you have to really be mindful about the limits and the appropriateness of those kind of things. Some games on Nintendo Switch are appropriate because a lot of them also teach you coping skills. Like, well, there's 1-2 Switch where they learn how to soothe a baby, you know, and put the baby to sleep. They learn patience, and you know, it's really fun. But other games like fighting games and stuff, like that's not really appropriate to do, right? So you got to use your clinical judgment on that, and you have to make sure that parents are okay with it. But the intention behind it has to be therapeutic. So let's think about appropriate rewards. What are appropriate rewards that parents can think of and utilize? That's important to a child.
Increased time spent together. So maybe they go to the park an extra day a week, or they watch a movie together, like have a family movie night.
That's excellent. The time spent together, quality time, is very, very important, because that's what kids want. Like, they want to feel, you know, like they're loved. They want to feel supported, that you know, there's people who want to spend time with them. So quality time would be good, and like, yeah, rewarding them with like a movie night. What other ideas y'all have? So planning this stuff ahead of time is good. Maybe like having their parents cook their favorite meal. Let's think about it in categories. Think about it with people you'd like to spend more time with. Maybe it's going to visit a favorite aunt or uncle, you know. And here's the thing to consider about rewards. Think about operant conditioning. When do rewards actually have a lasting when do they when are they most effective? When are the rewards most effective? Think about schedules of reinforcement.
When they're consistent and almost like positive reinforcement.
Yeah, so let's talk about that for a second. So consistency is very important, but let's say a parent's like, oh, you did a great job, you know, I'm glad that you were, you know, engaged in session. Next week I'll take you to McDonald's. Does that like help them really? Does that reinforce their engagement? Why not?
It's not very like immediate.
Right, it's delayed. So consider having immediate examples. So immediacy is very important. So taking them to a park right after session might be good, or taking them to a park. Let's say they practice a coping skill at home. Really, like, even words of affirmation right away can be really, really positive, right? Or giving them extra time to do a recreational activity, cooking their favorite meal, going to a park or a favorite restaurant, rewarding them with like a movie night, like right away. Doing those kind of things can be good. And then also anticipation for long-term rewards can be good, where there's a point system in place where they can then earn maybe something really big. That's also good, keeping it on their mind. And so, you know, taking things away that they think is bad, like, oh, you know, you don't have to do these chores this week, you did such a great job. That's really rewarding. That's negative reinforcement, which is still a good thing. Positive reinforcement is adding something good, right? So just consider that. I'm spending a lot of time on this because so much of what can be done outside of session can really help. Okay, so you have these situation cards, and you want to spend some time with the client to really think about their anxiety and the situations that are anxiety provoking. What are easy anxiety provoking situations that you can fill in these cards with? And you want to cut them out and you want to have them ready. Even for you all, what's an anxiety provoking situation that's not too intense, but easy?
Checking my student email.
That's a very good example. Yeah, checking your email. I get anxiety checking my email too. Okay. Now, with anxiety provoking situations that are easy, this is where you're going to come up with a plan for how they can practice coping and using relaxation techniques and cognitive strategies. But we'll go into that in a little bit. What's a more medium anxiety provoking situation?
Maybe presenting in front of a class.
Yeah, there you go. Presenting in front of a class is probably more medium. Let's think of it for kids now. What's an easy anxiety provoking situation for kids?
Going to school.
Okay, going to school, just going. And for some kids that could be very overwhelming. So it varies, but yes, it could be easy for some kids. Going to school is not the hard part. Being in school is the hard part, or going to certain classes could be the hard part, right? What about medium for kids?
Playing on a
Some-
sports team.
Playing on a sports team. Yeah, I like that one.
I was
Was
kind
it-
of thinking of it like in levels, like with the going to school one. So like easy would be like getting ready for school, maybe.
Okay, yeah.
And medium would be like getting dropped off or like the ride over there, because it's like the roller coaster, almost like the build. And then the hard would probably be like walking in, like that initial walk in and everybody's walking past you.
Right. Yeah. Like,
Yeah.
especially during passing period, crowded hallways, those are a lot more challenging, right? And then anticipating seeing people you don't want to see. So very good examples there. So it's good to, prepare some of these situation cards, because they're going to be times in session and after session that they take home with them, with their parents, where they practice preparing themselves for dealing with these situations. And if they know during the week these situations are likely to occur, before that day happens, the parents will go over the situation cards with them and coach them and practice with them, or they can do it with themselves, or you can do it with them in session. That's why it's a lot of preparation and planning, and kind of knowing their schedule and knowing these anxiety provoking situations beforehand to then practice and role play how they can deal effectively with these situations. And it can become a fun game to play with them doing this stuff. And then you got a fear ladder. A fear ladder is good, because what do you suppose the whole intention of the fear ladder is? What is it that we're trying to understand with the fear ladder? What do you think would be at the bottom of the fear ladder? Remember, this coping cat here says not too high. It's not too high. What does that mean?
We're scaling their fear. So things that they are less anxious about or less afraid of would be at the bottom. And then as it gets higher, that level of anxiety would increase.
Yes. Now, remember, these are all just on the supplemental pages in the appendix. So this is going to come later with each session. As each session goes on, you'll do different activities, and this is going to be one of them. But I wanted to show this to you because, yes, just like Ashley said, we're going to scaffold our way up to understand more anxiety-provoking situations and help them better prepare for dealing with them. Sometimes it's the same situation. Maybe it's a fear. Maybe it's a specific fear, like a fear of dogs, right? And maybe with the fear of dogs, we can start with dealing with just talking about dogs and seeing pictures of dogs. And then after that, maybe it'd be videos of dogs. Then after that, maybe more videos of dogs. And then maybe we'd actually even consider them going to a pet shop, looking at dogs or something like that, right? But we're becoming more and more we're increasing the exposure with a lot of this stuff with the fear hierarchy. Feelings barometers here. This is really to help them be able to identify different feelings and emotions and the vocabulary for it. Some kids have very, very good vocabulary. They're very articulate. They have a strong economy of words. And then some children need help expressing their feelings because they don't know what to say. They don't know how to say it. So being able to show and point out things, being able to recognize differences in emotions with different feeling, with different thoughts or with different situations is important. And then here you've got the FEAR acronym, and here's where they're going to learn about the FEAR acronym. F stands for feeling anxious. This is where we start out with feelings. Are you feeling anxious? E, are you expecting bad things to happen? This is now with thoughts. Are you expecting bad things to happen? Attitudes and actions that can help. What are the attitudes? What are the thoughts and the behaviors that can help us? And then what are the rewards that we can give ourselves to, you know, and the reactions and responses we want to have. So they're going to learn about the FEAR acronym, that they're going to ask themselves, what is the FEAR here? What am I feeling? What are my expectations? What am I expecting bad to happen? What are my attitudes and actions that can help? And what are my responses? So we're going to coach them on that. And then they get a certificate of achievement. I like having these because we get to celebrate their milestones, not just have one, have them like every few sessions. Like you get a certificate today for learning how to identify feelings. You get a certificate today for learning how to challenge negative thoughts, and just kind of say, you know, this is presented to put your client's name for outstanding achievement in the Coping Cat program for, and then you can say directly what it was. That can be really rewarding. So let me go back here in the beginning with session 1. So you introduce yourself. And then you might play a personal facts game. So what is your therapist's first name? What is your therapist's middle name? What's his or her birthday? What's their birthday? What's their favorite TV show? How many sisters or brothers do they have? This is where they get to know you, right? Because the more comfortable they are with you, and the more they get to know you and what you like, the more comfortable they're going to be in session. Okay. Now make up 3 of your own questions to see if you can find out the answer. So they get to ask you whatever they want. So it's good to spend some time with this, because, you know, they like this activity. So not only are you getting to know them, they get to know you. And then games. Pick out a game or fun activity to play with your therapist. This is a part of treatment. So we do play games because they have intention behind it. So some people may not understand, like, what do you mean you're playing games? Like a lot of times parents will ask, how was session? And then the kids will be like, oh, we played Uno. And, you know, so they might think, well, are they just playing games? So educate the parent on what you're doing and your intention behind this. Introduction to feelings and thoughts. This is still in session 1. You can use the Mo and Joanna example. You can show the personality triangle. Here's where you introduce thoughts, feelings, and actions. Throughout this workbook, we'll be talking about your feelings in different situations. Sometimes we'll talk about situations that you enjoy, and other times we'll talk about situations that make you feel nervous or scared. Let's start off today in a situation that was fun. I want you to think of a time when you really enjoyed yourself. Take a minute to think. Got one? Great. Now that you've thought of the situation, I'd like you to describe it in the space below. Tell me what the situation was, how you felt, and what you thought. Okay. I want us to actually go into a breakout room, and I want you to get with a partner, and I want you to introduce yourself. Someone can take on the role of a client, a young child, or a teenager. Somebody can take on the role of a therapist. And I want you to switch roles too, eventually. And I want you to introduce yourself, introduce the counseling process, and introduce, if you can, the personality triangle. You can introduce the Mo and Joe example, if you want. And you can also work on getting to show them how we introduce our feelings and thoughts, right? And this is all positive right now, in this sense, where sometimes, you know, it says here, we'll talk about situations where we're scared or nervous, but I want us to first start by introducing situations that make us feel good. So let me go ahead and put y'all in breakout rooms.
I have a question.
Yes.
How long do we have in the breakout room?
I'll give y'all 10 minutes, and you can take 5 minutes to do each activity. Like to switch roles, I mean, 5 minutes to kind of I'll probably give you more. I'll probably give you each like 7 to 8 minutes. So maybe we'll spend to like 16 minutes. So yeah, let's spend about 8 minutes each, where each person's like taking on the role of a therapist, and then you'll switch. So we'll probably spend about like 16 minutes or so. So by like 11:32, we'll all come back. But here's where you're just going to introduce yourself and introduce your client and try to kind of educate him on the cognitive model. If you're in a group of 3, if you're in a group of 3, 2 people can be co-counselors. Okay, I'm opening the rooms.
Am I supposed to join, Dr. I?
Oh, did you get added in? No, you don't have to join. Let me
Okay.
see. Let me see the one you're in. Just
5.
to make sure. Oh, I'm gonna move. I'm gonna move Araceli then.
Okay.
Let me move her to room 6. Okay. I think everybody's joined, so then yeah, like 11:32 we'll talk more about the curriculum.
Okay, let me see. Cool. I'm just trying to write down some questions for like the makeup quiz. Do you know how long you would like it to be? I think last time they only made it like 5 or 6 questions.
That's good. That's good to me. I'm gonna be right back. Okay, I'm closing all the rooms. Okay, I'm just waiting for everybody to get back. I do plan to give you all a break soon. And so before we do, I wanted to ask, how was that experience just introducing your client, a young child, to the first session, exploring, introducing them to CBT concepts? Do y'all have any questions about it? Anybody want to share anything challenging?
I found utilizing a jargon that is for like a child kind of difficult for me because I have a lot of experience working with adolescents previously and currently. And what I love about adolescents is that right away they'll be like, I don't know what does that mean? Like they'll vocalize right away. And I feel like a child would be mostly like facial expressions, like of them not understanding you. But yeah, I felt like I was using words that were hard to swallow for a child.
I'm glad you shared that. Yeah, thank you. Did anybody else feel that way?
Yeah, me and my group actually talked about that too.
Okay.
We thought it
cool.
was like another step in addition to like all the other steps that we have to kind of introduce to the client. So we can take one of those steps away, such as like the jargon that we use. We thought it could be like not faster, but like helpful.
Right. Yeah. So how could we communicate effectively in educating a client about their feelings without using jargon, and technical words that they may not understand? I have a lot of times in session, clients tell me, what does that mean? What do you mean? So, you get used to it eventually, but like, how can we help them understand these concepts without being too technical?
I was gonna say I pretended to be the child first, and I was like role playing an 8-year-old. And I think for me, what was helpful was just putting myself in the mindset that like I don't know anything. And so whenever they would say some words, I'd be like, oh, what does that mean?
Great, good.
Yeah.
Thank you all for those who were role playing, and taking that role to help your counselors kind of understand, like, they do need to speak in a manner that's easier to understand, because you don't want it to be over their heads. A lot of times too, like young children or adolescents, they may be like going along with you, but they don't know what you're saying to them. So yeah, you definitely want to use words that are developmentally appropriate. Can you
Yeah,
see?
Asia.
Go ahead.
Oh, sorry. I had role played as the counselor first, and then Asia and I swapped. And then Asia asked me like how I felt, and I said like shaky. I said shaky with energy, like to try to articulate anxiety, which was I think a cool experience for me to kind of like reverse. And then Asia turned around and asked me like, okay, so is it good? Like, does it feel good? Like, are you excited or is it bad? And I was like, no, it's bad. So that helped me. That whole role play helped me like break it down too.
Very cool. Good. Any other thoughts or comments or questions?
Sorry for excessively talking, but Kendall's example reminded me of like my counselors asked me a question of like, how did that make you feel? And I was like, oh, like maybe an 8-year-old might not know like feeling words. So I just said bad. And I think they did a great job of like expanding on what bad meant by like trying to focus on like pulling out like my experience and like my body sensations. And then they were able to like use my description to kind of then get to an emotion word that I was like, oh yeah.
Very cool. Oh, good. Thank you for sharing that. Any other comments or questions?
I found an important part of this that I guess is kind of like MSJCC, in using developmentally appropriate language is setting that precedent early with clients, no matter the age, like young children or adolescents, and letting them know, hey, sometimes I might say something and it doesn't come across right, or you're not really sure what I said, and I want you to know that it's absolutely okay. And I really want you to stop me and ask for clarification, and kind of giving them that power within session to call me out when I mess up. I think is really helpful for the therapeutic relationship and making sure that they get what we're talking about.
Right. Thank you for sharing that, Ashley. Yeah, so that they feel empowered, so that they feel safe to speak their mind and to ask questions if they don't understand. Good. So I'd like to give you all a break. So why don't we take a 7-minute break? And if you all need more time, does anybody need more time than that? Let's come back at maybe like 11:46 then. Take like an 8-minute break.
Doctor, really quick, I had a question about the.
Yeah, I'm here.
Yeah. Well, everybody else is on a break.
Let me pause the recording real quick.
Okay.
Okay, welcome back. So what I'm going to do now is get back to the curriculum. So we are still kind of wrapping up with session 1. Oops, let me go back here. Okay, so here we are with session 1. And this is again where you introduce feelings and thoughts to them, and they shared situations that bring them positive emotions and thoughts that are contributing to those feelings. So you continue kind of saying, what would a normal day look like? Describe a situation that happens on a typical day. Think of a time that was okay, but not great, but not bad either. Remember to say what the situation was and what you thought and how you felt. Now you give them what's called, this is essentially like homework. We call it show that I can. It's called a STICK task. So it's an acronym for show that I can. We're going to end each session with an assignment we call STICK task. A show that I can STICK task is something that you can do. Show that I can. You will be learning lots of new things, working with your therapist and doing this workbook. We want you to take what you learn from what you learn with you and use those new skills in other situations. That's why we came up with the idea STICK. They're your opportunity to practice what you've learned. Then at the beginning of each session, you can show your therapist what you've accomplished. It's your chance to boast. Every time you do a STICK task, you'll receive 2 points or stickers that you can use to earn a reward. What kinds of rewards would you like to be able to earn? On page 73, you'll earn a reward. You'll see a reward menu. This is where you can list each reward and the number of points that it costs. After session 4, 8, 12, and 16, you can spend your points on some of the rewards you listed in the reward menu. So that goes back to the reward menu we talked about earlier. And this is where you show them how, if they do follow up with the STICK task or their homework, this is what they can do. So I like to have them do different STICK tasks, but this is one which they say, write an example of another time you felt really great. You weren't upset or worried. Remember to describe the situation you were in. What were you thinking and how were you feeling? Do this task on your own for next time. When you and your therapist discuss it next time, you can earn 2 points. Be sure to remember. So here is where you give them this worksheet, and they describe a time they felt really great and they weren't too worried. This is just to kind of help them, get used to expressing, things, and then they write down the acronym. Do you remember what STICK means? Show that I can. And then session 2 begins with recognizing feelings. So this has to do with what we were saying before, how a lot of kids don't know how to express their feelings. They don't have that economy of words necessarily. So it's about now discussing different types of feelings and why we feel different things. So let's talk about this. Let's start listing different feelings that you can think of on the lines below. What might be the feelings that most kids will say that they know about?
Sad or mad.
Sad, mad, good. Yeah, usually it's like
happy.
Yeah, happy. Yeah, just like these are listed here. Sad, mad, happy, surprise, sad, happy, angry, mad, scared. So it's good to get them to learn those words and know what those words mean, but also supplement them with some other words to help them express feelings more and show them like a feelings vocabulary chart. That would be really, really helpful. But now notice it says, how do you know when someone's angry? So how might children know when someone's angry? What might they say to us?
Yelling,
Right.
or their facial expression.
Now this goes hand in hand with anxiety, right? Because typically people are anxious when they anticipate something or someone being unsafe. So try to understand that, like, and see if there's a connection there. Have you been around people who are angry? Who are they and what are they like? And how often do you feel them this way, right? How do you know when someone's sad? What might they say about that one?
Crying.
Yep, crying. What about teenagers? What might teenagers say?
Silence, not saying anything at all.
Yeah, not saying anything at all. And so you go over other feeling words with them. And then now that you are thinking about feelings, think about this. Besides saying what you feel, how else do you know what someone is feeling? Here's a question. How do you know when someone is angry? Can you think of 2 ways? Write your answer in the space below. So this is something that you'll be intentional with in session, where you get them to list more than one way they can tell when someone's angry, more than one way they can tell when someone's sad, more than one way when they can tell someone might be scared or nervous or anxious. And then now they match the face with the feeling. This is really the psychoeducation part. So what do you suppose someone's feeling with this first picture? That's a hard one.
Proud, maybe?
Proud comes to mind. That's probably the first one that I think of too, proud. And then you can give examples with them, like, what are times when you feel proud? What are times when you've seen others feel proud, right? And then you do the same thing with each of these other feelings. And you can spend more time on this. So this is all about feelings. And then you've got a feelings role play. Can you guess what I'm feeling? Try and show your feelings using only your face and body, no words. You can do it. See if your therapist can guess what you're feeling. This is kind of like a feeling charade. And this is a fun role play activity to do in session. They really enjoy it. If I were in this situation, I'd feel, and then you read the following stories and write them in the blank spaces. Write in a feeling that you might have. Your best friend comes running up to you on the playground. Your friend says, "Let's go play." What feeling would they have? So they would say, they'd probably say they feel excited or they feel happy, right? And then you can draw the feeling face. So this is where they are now actively participating in doing that, and they're thinking about these situations. Now with teenagers, there's with the CAT project, you got some other cool activities. And it follows a very similar format. Like the table of contents are very, very close. It's just that they have different worksheets. Here they still have the situations, thoughts, feelings worksheet. And then they have more stories. They call them take-home projects. They don't call them homework either. They call them take-home projects. But here for recognizing emotions in session 2, they do the same thing, recognize emotions. And in this one, you're taking the active role of like a detective. That's sort of what you and your client are supposed to be like. You're supposed to be like detectives in this curriculum, where you're trying to get to the story. You're trying to get to the bottom of figuring out the clues to help us know when certain emotions are occurring and when they're not. And especially when it comes to anxious feelings. But here's a cool activity where they find a magazine. Try to have a lot of magazines in your office if you can available, where there's lots of different people, lots of different pictures, and they cut out the pictures without looking at the articles that go with it. They just cut out the pictures, and they try to identify the emotions that the person's feeling. And it's kind of like a fun activity. You can do this with young children or adolescents. You could even make like a mobile with like hangers and string, and you cut out pictures and you have different feelings. You could do this for a lot of different things. with them, but I like doing that. And then this goes into bodily reactions and emotions. What are the bodily reactions and emotions and feelings of my parents? What about my siblings? What about my friends? And here you can also self-disclose a little bit of that too. Then briefly describe the situation in which you felt anxious. And now notice that there's a little thermometer here, or like a little rating scale. This is in the teen workbook. Going back to the coping cat, it's again similar. Here we're just drawing faces. What are these people feeling? It looks like, and this might be hard to see because it's kind of blurry, but here you can see people look like they're getting ready to go on a trip, right? So what might they be feeling? And then what might they be thinking? You can add that if you want. We're not at the thinking part yet, but we would eventually go there. How about this one? What do you suppose kids might say about each of these people here? What do you think these three people here in the picture are feeling? Excited, right?
Joy.
Joy. What about the person in the forefront? What is she feeling?
Excluded.
What was it?
Excluded.
Excluded. Okay, that's a good word to introduce to them too. And here's where you can have a conversation about like why this might happen and what they might be feeling and what they might be thinking. And have they ever been in situations where they felt excluded? You can self-disclose some situations to help them feel comfortable sharing and talking. And then you can talk more about this scenario. There's a lot you can do with this picture. You know, like, what do you suppose this person wants to do? What does it seem like they might want to do? Probably wants to join in, right? Maybe see if they would, see if the client would agree with that. And then you can have a whole conversation about that. So moving on, my therapist feels worried when. Ask your therapist about a time they felt worried or scared. Find out how your therapist handled the situation. So this is where you've got to be comfortable enough to self-disclose, and you want to prepare beforehand that you don't share something maybe outrageous. But then here's where you're going into the situation cards, and you have those situation cards ready, and you introduce to them how they're labeled easy, medium, and challenging. And then that's where they think of situations in which they only feel a little bit nervous or a little bit more or a little bit more. And then you write them in the cards. And then they'll use that fear ladder to kind of scaffold them up to rank them for easy, medium, and hard. So then you've got another show that I can task. On the next page, write about 2 situations that happened to you. One situation should be a time when you felt really nervous and scared or worried. The other situation should be a time when you felt relaxed. It's important to write about the situation as soon as you can, so don't forget about anything. Be sure to include details about what happened. Write down how you knew what you were feeling and your thoughts or feelings you had. I like to have clients draw pictures too, because maybe they don't feel like writing stories, or maybe they don't know how to write very well. So have them draw a picture. That's perfect too. And you want to give this prompt to a parent. And what I like to do is keep a folder, and I give the client, I make them a folder of these things, and they can keep these things in the folder, and they can keep the folder with them, and they bring it to therapy. So session 2, here's where they write down 2 situations that happened to them this week. One where they felt really nervous, scared, or worried, and then another time where they felt relaxed. And they're going to learn to distinguish the differences in those feelings. Okay. Watch someone else this week. It can be someone in your family or a friend or a TV character. This is great to use TV characters or YouTube characters, you know, superheroes. It's perfect to do that. Name the person, name the situation, the other's feelings, and what did you see that was a clue to the other person's feelings. So the clues, this is where you're a detective too. What are the clues to tell you how someone felt? Well, they might have been, you know, having their head down. They might have not have been talking as much. Well, then those are clues that they're feeling sad, right? So they do this as homework assignments or show that I can tasks. Now, session 3, how does my body react? Today, we're going to talk about the ways our bodies might react when we feel nervous. For example, as a cat, I show that I'm scared when my fur stands up, when I'm frightened. I feel like a scaredy cat. Sometimes being afraid is okay. There are times when everyone is a little bit afraid, but there are other times when we don't have to be afraid. When I keep my cool, I feel like I can cope with whatever comes my way. I'm a coping cat. What's cool about this is my wife has a therapy cat. She's trained to do animal assisted interventions, and she has a cat named Simba. And Simba is really helpful in session because there are times when Simba, models different behaviors when he's relaxed, when he's maybe anxious, when he's needy. And so he goes really well with this curriculum. So think about that if you are interested in animal assisted therapy. Texas State University has a great animal assisted intervention program that can get you trained in it. Okay. How do my family members show that they're scared? So here's where you would have them write those things in those spaces, and you can talk about it with them so that they can recognize their own family members' signs and symptoms, and then draw a picture of a person who's feeling scared or worried. Now, this is where they learn about their own body some more. How do our bodies tell us when we're anxious? Here we got a picture, a diagram of the body, and here they got different, pictures of organs. They learn about the heart, the stomach, the lungs, and this is where they learn about their bodily signs and symptoms and reactions. So let's look at the drawing of the human body below. Which part of your body gets a funny feeling when you're feeling nervous or worried? What would most kids respond with that one? What part of the body gets a funny feeling?
Their stomach.
Their stomach, right. So this is where you can talk to them about that and how this is a normal response, that they're not alone, but this is how they can recognize their bodily signs and symptoms. Now, here's an important thing to think about. Sometimes when people have anxiety, especially if they have like panic attacks and stuff, they feel like they've lost all control of their body, right? What does somebody not have control over when you think about their body? Do they have control of their heartbeat directly? No, right? Do they have control of their stomach directly? Like, can they tell their stomach not to digest food? No, right? What do they have control over?
Breath.
Exactly, their breath, their breathing, yes. And their arm muscles, yes, they do have control over their arm muscles. So we'll begin introducing how they can control their breathing, and they'll notice that they can take control back over their body when starting with controlling their breathing. Now, how would you introduce breathing techniques to a child? What are some ways we can do that?
Have them mimic like they're blowing out a candle.
That's
like really
perfect.
slow.
Yeah, I love that one. So I love it because, think about first how we inhale the breath, right? And I like to do the breathe in the flowers, smell the roses, smell the flowers, and blow out the candles. So, I'll have them pretend like they're holding flowers in one hand, and they'll go like they're breathing in the flowers, and they go like they're blowing out the candles. The kids like to do that kind of stuff. That's a helpful one. But think about like how babies breathe, right? Babies breathe like with their tummy, like when they're like sleeping and they're very relaxed, they'll breathe with like the lower lobes of their lungs, right? So have them kind of watch a bit, like if you can, like show them videos of it or something. But that's where when you're taking slow, deep breaths from your abdomen, you're putting yourself in a more relaxed state. Whereas if you take a deep breath from your chest, like chest breathing, that's not as relaxing. That's kind of like what we do when we want to tense up, like we want to prepare for a fight or something, right? So help them know the difference between breathing styles and how breathing through our abdomen, like abdominal breathing, is one that can produce a state of relaxation, and help them practice that. I also like to use the hand, where they trace the hand up, and if for every time they trace up, they breathe in, and then when they go down, they breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Tracing their hand is another really good coping skill and activity that they can do, and they can add it to their show that I can task. So progressive muscle relaxation is good too, because they can practice relaxing different muscle groups, and they work themselves starting with their head, their forehead, to their shoulders, to their chest, to their abdomen, going all the way down to their legs and feet. So let's answer some questions about how your body reacts. Sometimes there are several different reasons that could explain your feelings and how your body is reacting. Read the following situations and circle the number of reasons you think is the most likely reason why, why the person in the story feels the way they do. Marina was very hungry. She ate the tuna fish that had been in the fridge for several weeks. A few hours later, her stomach felt upset. Why do you think her stomach hurts? Is it because the tuna fish was spoiled, somebody punched her, or because she's worried about a test? And so they'd say, well, it's because the tuna fish, right, was spoiled. So just so they know like how certain experiences can mimic that. Now, Terry is about to give a book report in front of his class. He notices that he feels sweaty. Why might he feel that way? Is it because he ran to school earlier that morning? It's hot. It's a hot day outside, or because he's nervous about speaking in front of the class. This is where they can learn how what we anticipate causes us somatic symptoms and responses like sweating or even an upset stomach. The last time Chris went to the dentist, he had to have a shot that hurt a little bit. 6 months later, he's in the dentist's waiting room again. When the dentist calls him to come and sit in the dentist chair, Chris feels his heart beating really fast. What could have caused his heart to beat so fast? He swam in a race right before he went to the dentist. He drank too much soda pop. He was worried about what might happen with the dentist. He was probably worried that he'd get another shot again. So this is where you kind of explain to them the differences. And so this is where you want to help them with that. Now we're at the first letter of F. This is where we're teaching them fear, F-E-A-R. So let's learn the first step of coping with anxiety. Feeling frightened. This is where they recognize how their body feels, so that if they're worried, so this is where they recognize that their body feels tense and that you're worried is the first step in learning how to cope with situations that make you anxious. And then you help them remember that step. And then they have a show that I can task. They have another homework assignment where they draw their own rating scale to rate how their body feels in different situations. Pay attention to how your body reacts when you feel different. See if you can tell how anxious you became by how strong the feelings inside your body were. Then use your rating scale to record how you felt about the situation. And then they have the show that I can task where they draw their rating scale, which could be like a thermometer or something like that. It could be an engine where it goes from red, yellow, green to feeling anxious, right? And getting their heart rate up and their body going. Our body's kind of like an engine, right? And when our engine is revving really hard, all these things are happening in our body. Write down 2 times this week where you felt scared and worried. Give them a rating with your rating scale. This is where they incorporate their rating scale to their situations at home. And then you got a parent meeting in session 4. And this is where the kid can take a week off. Now, in a parent meeting, what would you think would be good to talk to parents about in a parent meeting? This is where it's kind of free to guide it your way. What can we do with the parent meeting? How would you take advantage of a meeting where you're meeting with the parents now? You've already had 3 sessions with the kid.
Maybe get an idea of what the child's emotional regulation looks like at home, or what they've gotten reports from teachers at school.
Perfect. Yes, that'd be really helpful. You want to make sure that they're doing their show that I can tasks, right? What should parents know when it comes to managing their child and being with their child? What should parents know about how to approach their child and how maybe they should not approach their child? What recommendations might you make? Because they might ask you, what do I do? Like, she doesn't want to go to school, or he doesn't want to go to school. He he's so scared and nervous. He doesn't want to go out anywhere. He just wants to stay in his room or stay at the house. So I take away his stuff. So what would you recommend?
Asking questions. So like, why do you feel anxious, upset, fearful? What's going on for you right now? Before like maybe the activating moment, like the going to school thing. So advising them to like lead with curiosity and questions, not necessarily lead with punishment. I guess leading
Right.
with patience too.
Right. Excellent. One thing I want to mention too is that parents, they model a lot for their children. Sometimes they model anxious behaviors that their child picks up. And if they also perceive their parent to be anxious out in public or in certain places, they might feel unsafe too. And they might feel like, they feel guarded, and they look to their parents sometimes for support. So oftentimes if parents struggle with anxiety, sometimes their children struggle with anxiety too. So just keeping that in mind. Sometimes parents will overreact and they'll try to punish their children. If they don't do this, then I'm going to take this away. Or if you don't do this right now, then they yell at them, right? And then the child feels even more anxious, and they don't feel like their parent can support them well. So kind of keep those things in mind and talk through that with the parents so that they don't do those kind of things. Rather, have them encourage them, have them recognize like, hey, your child really responds well to feedback and encouragement. Give them, like strengths and stuff. Joining them in coping skills is good, so that the parents can model the coping skills and teach them and remind them to use their coping skills and relaxation techniques. And then coming up with a system. This is where you can really emphasize that system for rewards. How if you see them using a coping skill, reward them right away. This is a good opportunity for that. So they don't get a show that I can task this week. So session 5, let's relax. This is where they learn about all kinds of different relaxation strategies. I love the robot ragdoll technique, and it's really fun to role play this with kids. Think of a time when you felt happy and relaxed. Imagine that you're in that situation. How does your body feel? Now make a fist. Does it feel different than how your body felt when you were relaxed? When I get tense, my body feels stiff like I'm a robot. Try to be stiff, just like a robot. My favorite robot is C-3PO from Star Wars. I tell them Johnny 5, but they don't know who Johnny 5 is. Think about, and Star Wars is pretty popular now, but if you know of any cool robots, or if they like robots, bring that up. Think of your favorite robot. I bet that you can walk just like a robot. Just tighten your muscles and give it a try. So they're going to practice walking around like a robot in session with you, and you can do that too. I've done it plenty of times. So walk like a robot, and they'll have a lot of fun with you doing that. Then they have to practice relaxing their muscles. Try to be floppy like a rag doll. Pretend that you're Raggedy Ann or Raggedy Andy. I've had a client who was scared of Raggedy Ann dolls, like terrified of them, because they're in some scary movie. So you got to assess for that. Do you know, just try to think of like a doll, right? That's like loose and relaxed. So practice that with them. It can be really, really helpful. And have them do it. And then you can kind of play like a Simon Says activity, right? But it's like, okay, robot ragdoll, and then Raggedy Ann, and then they'll kind of change their posture and stuff. And you can do that with parents too. So here they practice, and they're basically getting used to their body being tense and stiff to being relaxed. And then they'll describe the differences. The more they do robot ragdoll, the more they're going to know, okay, I can control my body. And because I can control my body, I can control my body during anxiety-provoking situations. So here they learn about being relaxed to tense. And here you've got where they rate different ones, and you show them different ones, different examples. And you might want to expand on this, show them videos, show them, different scenes. But here, this cat probably is really relaxed. This is probably like a number 1. This cat is probably like all the way to 4. This is very tense, right? So you'll get them to practice rating the different pictures of cats and scaling it, and then they do that with themselves. Here they learn about the muscles of the body, the back, the biceps, the calf, the chest, the feet, the forearms, the hands, the thighs, the neck, rear end, shoulders, stomach, and triceps. So they learn all about the muscles of the body and how they can tighten different muscle groups. And this is where you can go further into progressive muscle relaxation. Don't ever make them tense like 100%. Tell them if they're going to tense different muscle groups and they work their way down different muscle groups to tense like 80%, because 100% they might hurt themselves. Okay. So they'll do that. And then for their show that I can task, they'll try to relax at home. They'll record their experiences with the relaxation in their notebook. And then they'll write down the day and time and describe how they became relaxed. And then they'll describe 2 experiences in which they felt nervous or scared, record the thoughts they had and how your body felt. Now they're starting to pay attention to their thoughts. So this is a big one. So here, the day they felt relaxed, the time and how they would rate it, and how they became relaxed. So they had to talk about things they did to become relaxed. Was it robot ragdoll? Was it progressive muscle relaxation? Was it the deep breathing? Was it coloring? What other enjoyable activities do you all do, or do you think kids do, that promote a sense of relaxation? What are some things that we can list? Because this is where we got to share the resources and give them the education and the knowledge of relaxing activities. So what are some things you all do that help you relax? Listening to music, great. That's a good one. Relaxing music, right?
Reading a good book.
Reading a good book, yeah. Even for young kids, reading a good book or being read to can be relaxing, and that can be an activity their parents can do.
Watching my comfort show.
Comfort show, yeah, watching a comfort show. Awesome. Going outside in the sun, yeah, that's really good. Especially nowadays, maybe the weather's getting a little bit better, a little cooler out, and the sun's out. It's not too hot. Watching shows is good though, because they like that a lot. Watching their favorite show that helps them relax.
I have a question.
Yes.
So do like mindless things like TikTok would count as relaxation? Because I've heard that like no, but I don't know.
I don't really recommend it because it's hard to really even control what you see. I don't have TikTok, but I assume it's like where you scroll, right? So you see things and you don't know what's coming next, maybe, right? Does that happen in TikTok? So I would be hesitant because maybe some anxious situations might pop up or be seen. Now watching a show that they like on YouTube on their tablet or phone, that might be different. Or watching a show on TV, that's okay. But I'm glad you brought up social media and things like that, because yeah, a lot of kids do that. But here's the thing, right? So many kids have said to me that they're scared of something they saw on TikTok or on social media. And so one of the most important concepts I want parents and kids to understand is to guard their mind. We have to guard our mind. How do you guard your mind? You guard your mind with what goes through your eyes and what goes through your ears. That's how you guard your mind. And kids have to guard their mind, and they have to filter. They have to know how to discern and filter what's in their mind. And so many things that they see on social media then kind of burn into their mind. It becomes like engraved in their mind or seared in their mind sometimes, and they can't get certain things out, or they can't get things that they've seen out. There's a lot of conspiracy theories on social media, people talking about stuff, people talking about, oh, the aliens or whatever, making people terrified, young kids. So we got to really be guarding our kids, because the world is co-parenting our kids through social media. So I tell that to parents. So spending time with pets is a great activity. It's probably my number one activity, spending time with my pets, because it like resets me. Pets are really fun to play with, very enjoyable and loving, and they look forward to seeing you. So being with pets is really, really helpful. and really good at promoting a state of relaxation. What else relaxes y'all?
I specifically listen to music without lyrics, so like frequency music, because I'm a little sensitive to like lyrics in music, even if it's a relatively peaceful sounding song. It could have like one verse that's sad, and then I'm done.
Thank you. Yeah, me too. Same here. Yeah, because lyrics are words, right? And words are the framework of meaning, and we take in the words, and then we have a whole new understanding. And music is very influential, and that often happens a lot. So thinking ahead, when you work with adolescents, pay attention to the kind of music they listen to, and then the kind of rules they adopt from the music, because music can be very healing and therapeutic and influential, but it could also be the kind of music that tells them to, be, oh, don't trust no girl, like those kind of things. So then that kind of music causes more anxiety, you know what I'm saying? So pay attention to the lyrics they listen to and stuff like that, because it can be really impacting their anxiety in a lot of ways that they don't realize, based on the messages that they're taking in. So, okay. So you continue on. Describe 2 times you were nervous or scared this week. Write down the situation and how your body felt, and then give the situation a rating using your rating scale. I was nervous, scared, or worried when. They continue doing this for several sessions. They talk about situations with you, and you explore how they handle those situations, and then they're using all the techniques and skills that you're learning with them, identifying how their body reacts, learning about the fear model, feeling anxious, expecting bad things to happen, attitudes and actions that can help, rewards and new reactions. Now, session 6, what am I thinking? This is where you talk to them about thoughts again. You remind them of that cognitive model and how you're going to focus on examining their thinking in different situations. So here, they have some different examples. This is a cartoon drawing of the Lincoln Memorial, a statue to memorialize one of the great presidents of the United States. We call the balloon over his head a thought bubble. It's where the cartoon character's thoughts go. His thought bubble is empty. What might he be thinking? Take a minute to think. Then turn the page for what he might be thinking. So while it's a statue, I like to have them pretend if it was really the president, Abraham Lincoln, sitting in the chair. What might he be thinking, right? Maybe he's thinking about all the responsibility he has. That might be anxiety provoking. Turns out he really wishes he had a more comfortable chair. He wishes he had a recliner. That's what he was thinking. So he wants to be more relaxed, right? He wants to relax. So he's thinking about sitting somewhere more comfortable. Let's think about other situations. For each cartoon, take a look at the situation, then figure out what each person might be thinking. You can prepare other things like this, prepare other pictures, and have them try to anticipate what someone is thinking. This is a really good activity for them. Do this with magazines, do this with other stuff. I love this. Okay, so what do you suppose he might be thinking? What do y'all want to say? What might a kid say?
Yum.
Yum, right? Like, I can't wait to finish cooking this because it's going to taste so delicious, right? I love to grill, but there are some times where I feel anxious and I have some anxious thoughts. Like I'm thinking, am I going to burn the food? Will my guests like this? Will I make this in time? Am I prepared for everything? So that sometimes causes me anxiety, right? But then I think about how I can cope. Well, I have cooked these before. I have instructions, I have recipes, different things. So all those kind of things help me, right? So I kind of share those examples, right? Am I going to be able to control this fire? Like those are like anxious thoughts that I have, right? So I talk about how I work through them and how I work on challenging those thoughts and how I cope with those thoughts. And I go through the whole gambit. I identify how my body feels, my body reactions and signs. I go into that with them. What about this one? What might they be thinking here? What's out there? What could be out there? If you ever watched the show Alone, it's like on Netflix where they're like sent out into like the forest of like somewhere in Canada, and they have basically like 10 items with them they have to survive, and they make like a little shelter, but then like there's like bears and mountain lions everywhere and stuff, and they're always like dealing with anxiety provoking situations, and this kind of reminds me of that show. But yeah, so it's cool. But this is right, like they might be thinking what could be out there. Is there like a dangerous animal out there, or are there people, you know? Or maybe there's positive thoughts like, are my friends coming? So sometimes it's not easy to tell what someone would have thought in a situation. In many situations, different people might have different thoughts. Let's consider the situation. A teacher just announced to the class that the class would be going to the roller rink. Let's meet two of the students in the class. Chris has taken rollerblading lessons for a year and hopes someday to compete in contests. Terry went rollerblading only once before, fell too many times to count, and went home with sore ankles. What do you think Chris and Terry would be thinking when they hear about the class trip? What do you think they would have similar thoughts or very different thoughts? So what do you think Chris's thoughts are? Chris is probably thinking, I'm going to be like awesome. You know, I get to show off my skills. I'm really going to enjoy this. What are Terry's thoughts? What would y'all say?
Oh no. Not excited.
Not excited because if I go rollerblading or roller skating with my class, then
I'll embarrass myself or get hurt.
I'll embarrass myself. I could get hurt again, right? Yes. I'm going to do terrible and others will laugh at me. Yeah, that's very likely of a thought someone in Terry's situation might have, right? So many times I've worked with kids and they have experienced embarrassing situations in the past, and that stays with them and it doesn't go away. And I can remember a young man I work with very bad social anxiety. He had a situation that started where a teacher yelled at him in front of the whole class, and it embarrassed him so much that all the kids started laughing at him when the teacher yelled at him, and he never could go back to class again because he was so embarrassed. Now, not everyone knew about the situation, but he knew that those kids did, and he was afraid to go back. And then what he would end up doing is when some other kids would say, hey, how come you're not going to school? What's going on? He would make up a lie. He would say, oh, I'm sick, or I'm transferring to another school, or whatever. And he'd make up a lie, and he would lie so much that he had to remember his lies. And then he was anxious about having to defend his lies. And it became a snowball effect where he got more and more anxious with whoever he was talking to about why he's not going to school. And so it was a very anxious thing for him. And it all stemmed from that one moment of embarrassment that led to social anxiety, with a fear of being caught in a lie, and in a fear of being criticized again or made fun of by his peers. So that's very, very hard. Now look at the cartoon below. This time the character has two thought bubbles. Try to think of two very different thoughts that the person might have. Write each one in the thought bubble. So this is where they practice recognizing and identifying different thoughts somebody might have in different situations. Different thoughts equal different feelings and actions. So you got thought one, thought two. Here's where you want to connect feelings, thoughts, and actions. Thoughts, feelings, actions. Thoughts, feelings, actions. So this is where we're connecting them. Some types of thoughts can help people relax in situations, while other thoughts might make people feel more nervous and scared. Take a look at this cartoon scene. Circle the cat that would be more frightened. So here they go over the differences, right? Now, I'm gonna show you this last thing here. It says expecting bad things to happen. Then they role play. So you got different role play situations. When I'm in a situation that makes me feel anxious, it helps me to notice what my thoughts are. For example, one day last spring, as I was chasing a squirrel, I followed it up the tree in the backyard. I didn't catch the squirrel. I never do, but I was high up in the tree and suddenly felt really scared. I didn't think I would be able to climb down without falling. My thoughts were that I would be stuck in the tree forever. When I noticed what I was thinking, I asked myself, is it likely that I won't be able to get down? I remembered that I had climbed this tree several times before. Each time I had climbed the tree, I also had been able to climb down. So sometimes we're in situations where we find ourselves in and we're like, how am I going to get out of this situation, right? So try to share other examples of that. So here they have another show that I can task where they write a time that they were nervous, scared, or worried. How did their body react? What were they expecting to happen? Now they're focused on thoughts. And then a time that they were scared, anxious, and nervous, they do the same thing again. Feeling frightened, expecting bad things to happen, and then they go on. So in the teenage workbook, I want to show you that here we're going to go more in depth to talk about, like, here's another like roller coaster example. Here they learn about thinking traps. Thinking traps are really important to teach kids. They're basically cognitive distortions, right? You want to educate them in identifying their thinking traps or cognitive distortions. Thinking traps, I think, is a little friendlier way to say it. So there's different ones. Try to recognize any thinking traps that you might notice. Walking with blinders, not thinking about all of the possible good things that could happen in a situation, just thinking something unwanted is going to happen. So like in order to get like horses to move in one direction, sometimes they'll put blinders on the horse because they just want them to focus ahead, right? Sometimes we walk around with our own blinders where we're not paying attention to other things around us, things that could be going good, right? We just got our blinders on and we're just focused in one direction. And we're not thinking about all the possible good things in a situation. So that's a good thing to remember to teach clients about is, are you walking with blinders on? The repetitor, this is as if it happened once, it'll always happen again. It's like a rule we make up. If it happened once, it'll happen again that same way. If I go to school and kids make fun of me, or if I was made fun of by a group of kids, they'll make fun of me again, right? Some of these repetitor things are more realistic than others. That's why it's challenging, because with anxiety, people are convinced with their thoughts and they defend their thoughts a lot. So you really got to spend time being patient with them and helping them unravel those thoughts slowly. The catastrophe, always thinking the worst is going to happen. This is where someone catastrophizes. So you want them to be educated on that too. Don't overwhelm them with all these thinking traps right away. Introduce thinking traps one at a time, especially if you feel like it's really relevant to them, okay? The pessimist, expecting things to always turn out badly. That's another thinking trap we fall into, where we always anticipate the worst to happen most of the time. That's often contributed by depression and really bad experiences too. Pick, missing the good parts, but picking out the potential dangers in a situation. The avoider, okay, avoidance is such a bad thing we want to reduce, because avoidance just keeps people from really being able to function fully, right? Avoiding can be healthy. Sometimes it's appropriate to avoid some situations. We got to know when we avoid and when it's going too far. Avoiding or staying away from situations or things you think are scary without first trying and seeing if it is really dangerous or as scary as you think. I'm going to share a different screen. I think my Zoom froze. Can y'all hear me?
Yes, we can hear you.
Can y'all hear me? Sorry,
Yes.
I lost you all. Sorry about that. Okay. So here's another screen. Do you see the cycle of anxiety on the screen? I talked about this earlier, but this is from Therapist Aid. It's really good. You can supplement this curriculum with all kinds of cool worksheets and stuff, but I really like educating them on the cycle of avoidance, okay? So with anxiety, an anxiety-provoking situation leads to uncontrollable symptoms like worry, fear, a racing heart, sweating, or feeling of being overwhelmed. What do people typically do? They then decide to avoid the situation. They don't go to class or they don't talk to those people, you know. Uncomfortable symptoms are controlled by avoiding. That's kind of how we do it. So how do we avoid? Skipping class. Sometimes people emotionally avoid by using drugs or alcohol. Even with trauma and intrusive thoughts, they'll have to try to avoid those by using drugs and alcohol to avoid the trauma situations that they remember, right? But let's talk about behavioral avoidance first. Procrastinating on challenging tasks too, like maybe they avoid having to turn in their homework or having to work on it because they don't want to, or they feel like it'll be too unpleasant. So what happens with avoidance? What happens with leaving a situation or not doing something? They have short-term relief. Avoidance of the anxiety-producing situation gives an immediate sense of relief. The symptoms of anxiety lessen, but only temporarily. And then what happens in the long term, where they still aren't prepared, they still haven't they haven't learned how to deal effectively with the anxiety-provoking situation, and the fear that initially led to avoidance worsens. The brain learns that when the anxiety-producing situation is avoided, the symptoms go away. As a result, the symptoms of anxiety will be worse next time and avoidance is more likely. So they just reinforce that cycle of avoidance. That's why we have to stop the avoidance behaviors and have them and encourage them. And you'll meet resistance, for sure. You'll meet resistance, but you have to encourage them to fight against those anxiety provoking and producing situations. And so that's why I talked about scaffolding and systematic desensitization and relaxation techniques. That'll help them work through some of this stuff. Okay, I'm going back here. So back to thinking traps. So we jump to conclusions a lot. That's a big thinking trap that we need to avoid. Jumping to conclusions is where we don't get all the facts right, but we assume, you know, what's going to happen or what's going on. So we jump to conclusions about what's going to happen. We jump to conclusions about what people think. That's similar to the mind reader. The mind reader is where we are thinking we know what other people think, right? We're reading their minds. We're jumping to conclusions again about how someone might be thinking about us. And a lot of times with social anxiety, kids will jump to conclusions and say, if people get to know me, they won't like me, or they'll criticize me. Or if I go out in public, they'll make fun of me. Or if I eat in front of people, they'll think I'm disgusting. You know, they'll criticize me. So that's what oftentimes people do, is they do mind reading and fortune telling, which is basically jumping to conclusions. And then you have the fortune teller predicting what will happen in the future, and usually predicting things will go badly. It's another type of example. And then you've got shoulds. It's like really absolute rigid thinking. I should have this, or it should go this way. I should always get all my responses right on the homework. And if I don't, then that's awful. I shouldn't feel nervous ever. Because I feel nervous, I'm weak. You know, pay attention to those kind of thoughts because they're not helpful. The perfectionist, setting expectations for yourself that are too high. So we have to set realistic expectations. I was working with a client the other day. Expectations are way too high, and she is feeling like she wants to escape her life. Why? Because she has all these unrealistic expectations that are just a heavy burden on her. So walking through that, talking through that, processing that is important. Again, practice thoughts, behaviors. Are you expecting bad things to happen? Do I know for sure this is going to happen? This is where you want to help them examine their thoughts. And this is where I like to use the example, taking their thoughts to court. Is this really true? Is this really helpful? What's the evidence? Let's say we're in court. What would the anxious prosecutor who's attacking us say about why you should run away or why you should avoid? Now, let's try to defend ourselves here to say why anxiety is going too far. You know, and this is where you can use your creativity and imagination. But here are helpful questions. Do I know for sure this is going to happen? What else might happen in this situation other than what I first thought? What has happened before? How many times has it happened before? Am I falling into a thinking trap? So you might have to coach them and guide them together to challenge the thoughts that anxiety is presenting to them. And then you have to help them examine, is this thought really helpful? And is this thought true? And I like catch, check, change, because I kind of think of it like a game of hot potato. I use like a stress ball. And if we're talking and they say a thought that I think is like a thinking trap, I'll toss them the stress ball and they have to catch the thought. When they catch the thought, they have to check it. Is this thought helpful? And is this thought true? And then they have to work on changing the thought by replacing it with a more realistic thought. And this takes effort and practice. And this is where you have to go there with them and use brainstorming, problem solving, solutions. You have to generate solutions with them and do that with them. Here are examples of coping thoughts. I'll just try it this way and see what happens. Maybe it won't be as bad as I think. What's the big deal? Something like this happens to everyone once in a while. So I'm not perfect. I don't know who is. I've been in that situation before and I survived, even if I didn't like it that much. I survived and I can do it again. This is where you want to highlight their strengths and what they're capable of and what they've overcome in the past. So then they write down the coping thoughts here. You write down the coping thoughts with them. And then again, take home project. And this is with the CAT project for teens. But here is where they write situations, thoughts that they've had. So going back to the coping CAT, I'm scrolling back up. It's a lot of the same where it's them practicing this over and over again. What should I do? Session 7. Again, they're learning about attitudes and actions that can help. Now I'm gonna change gears real quick, and I'm gonna use my whiteboard. I want to talk about 3 types of behaviors people typically do based on their thoughts. Okay, we have maintaining behaviors. We have opposing behaviors, and we have avoiding behaviors. These are common 3 types of common behaviors people do based off their thinking. Okay, what do you suppose a maintaining behavior is as it relates to their unhelpful thoughts?
Anything that they do that would support them having the unhelpful thought.
Excellent. What are some examples of maintaining behaviors, thinking about like a kid or a teenager in an anxiety provoking, who has trouble with anxiety? Let's say social anxiety. What would be maintaining behaviors that support that belief of, if I talk to kids, they'll criticize me, I'm unlikable?
So being withdrawn, like maintaining like avoidance of social scenarios or interactions.
Correct. Yes. And it is a distinct behavior from avoiding behaviors. We'll get to that in a second. But maintaining behaviors reinforce the core belief, typically. These are behaviors that are in support and aligned with that belief. So if they believe that they're going to be made fun of and criticized, they'll probably do behaviors that reinforce it. So they'll anticipate somebody being critical. They'll probably avoid others, right? So that they don't see them to be criticized because they believe that they will be. What are opposing behaviors? let's think about someone who's depressed. If someone has depression, let's think about it this way. What are maintaining behaviors with someone that has depression and thoughts like I'm unlikable, I'm worthless, I'm no good? What would be maintaining behaviors?
Isolation.
Okay. How might they behave if they believe they're worthless?
Don't interact with other people.
They don't interact with other people. How might they take care of themselves?
They won't.
Little to no self-care.
They probably won't, right? They probably won't take care of themselves very well. They probably will be disheveled. They may not have good hygiene. Depending on how depressed they are, right? That's possible. They feel like, what's the point? Nobody cares about me. Why should I present myself anyway for anyone? What would be an opposing behavior? Maybe that goes even too far.
Doing things that are opposite of maintaining behaviors, like going out or taking a shower or something.
Yeah, maybe like excessively, right? Putting on a lot of perfume, makeup, cologne, things like that. Wanting to dress in a way where you want to be liked because that's what you want, is to be liked, but you don't believe you are, but you're opposing it, so you're doing the opposite. Being really, really clingy with people, being really affectionate, or really like trying to be really overly friendly. Those are also examples of opposing behaviors people do to make up, to kind of deal with that core belief that they have about themselves. Because they have those beliefs about themselves, they do sometimes those behaviors. Avoiding behaviors typically are behaviors that are trying not to activate the beliefs. So they try not to even be around social situations so that none of those beliefs, they're like sometimes a lot of the maintaining behaviors. Now with anxiety, it's typically maintaining and avoiding, or sometimes opposing too. What would be an example of opposing if somebody has anxious thoughts?
Overconfidence. maybe.
Overconfidence. Excellent. Yeah. So it's still like a maladaptive thing, right? Where people act very arrogant, people who have maybe insecurity, low self-esteem, or even low self-efficacy. Like I remember playing basketball with somebody who was acting super arrogant and, oh, like I'm gonna win and we're gonna win and we're on the same team, and would ball hog because they wanted to prove that they are a really good basketball player. And then when we got a chance to talk about it, he admitted, well, he's actually very anxious and he doesn't think he's really good at all at basketball, and he was trying to prove to himself that he could do it. So it's kind of like an example, right? Some people will overcompensate with these opposing behaviors to deal with that insecurity. So I just wanted to share that being common thing. So there's a question in the chat: are opposing behaviors similar to that of compensatory behaviors? So one of compensating for low self-esteem would be dressing up. Yes, exactly. Perfect. That's exactly true. That would be an example. So let me go back to curriculum. So what are attitudes and actions that can help? So it says here that you'll see a page titled Attitudes and Actions. Whenever you have an idea about an attitude or action that can help you cope, write it on the page. Then if you need some ideas, you can always look at this list. So attitudes and actions have a lot to do with reflecting on their strengths, reflecting on what you've learned about them, about what they're capable of, and times when they've overcame challenges and what other people would say about them. This has to do with you being intentional and exploring this with them about their personal history, and acknowledging their achievements and accomplishments, and explore what this says about them and what they're capable of. Okay. So that's how they can help them cope with these things, to build on their self-esteem and their self-worth, to help them show that they're a lot more than who anxiety says they are. They're not what depression and anxiety says about them. They're a lot more than that. So How do these steps help? Again, now they're putting it all together. Feeling frightened, expecting bad things to happen, attitudes and actions that can help. So ask yourself, what might happen if I chose the first? Okay, here's where they choose ideas for how they can deal with situations. How would I feel? What might happen if I chose the second idea? How would I feel? What might happen if I chose this third solution? This is where you brainstorm solutions with them. Again, think of a situation that made you feel anxious or scared. Write it down in the space below. Your feelings, your thoughts, your actions. And then things they've learned so far, things they've learned on how to deal with it. And then they kind of keep on going. So session 8, a lot of the same thing, except this time it's results and rewards. Now they reward themselves. This is where we talk about rewards. It's good to introduce this to them in the beginning, but they ought to learn too that they can reward themselves. It's good to remind them of this, make sure that they have a reward system in place for how they can reward themselves when they use their coping skills. Here, this is talking about using a feelings barometer. You'll notice that a lot of these curriculums, they move really slowly. And kids might be able to pick up on a lot of these strategies and techniques early on in earlier sessions. So it's okay to fit that in. Try to still make each session relevant and new so that they can apply it. So again, you're using the fear model, results and rewards. How did I do? I rewarded myself by, so how did you reward yourself? I like, sometimes when I feel anxious, if I got to teach a class, I feel anxious a lot of the time. And afterwards, I'll go reward myself on dealing with it appropriately. I get a Coke or an ice cream or something. So it's good to do that. Reward yourselves when you do something that makes you anxious and nervous, but you overcame it, you accomplished it. Reward yourself. I'm probably gonna go to Dairy Queen after this. So anyway, different things. Okay, so here you got, again, the reward menu. That you got the fear plan. They learn about the fear plan, and it's a lot of the same stuff that repeats itself. Here they do more drawing activities. Remember to use more role play. Remember to do more relaxation techniques and exercises. More practice. A lot of the same again. A lot of the same worksheets again. It goes all the way through. And now we're doing the cards. The easy, medium, and challenging cards. This is where you're going to have, since you spent so much time with them all these sessions, you know a lot of different scenarios and situations for them. So now you've got these cards filled out, and now you're going to use these cards where they're going to practice with you in session how they're going to deal effectively and make them realistic. So if you know somebody is very anxious about eating in front of others, for example, this is where they can learn how to do that with a coping card and how they can, you'll plan how they're going to cope with it. And maybe it'll be something that they're going to have to do during the week because they drew it in your stack of cards. So again, more practice, practicing real situations. Try to find scenarios that they can relate to. I know it's already 12:55, so I'm just kind of going through these other worksheets. It's the same thing again. Coping cards, session 14, practice some more, practice challenging situations, teach them relaxation and coping, help them, use these cognitive strategies, supplement other resources, use their parents, get their parents involved. Definitely want to reinforce good behavior. Here's where they think about superheroes and write down characters in situations in which they practiced coping with stress, how they regulated their emotions, how they challenged negative thoughts. It's going to take some preparation for you to have that. But this really helps. So they get more of these show that I can tasks, more of these things. And then they came to session 16. By this time, they should have the coping skills to deal with a lot of these situations. So here's all the supplemental stuff. So it's almost 1, it's 12:56. Let's go ahead and take a 10-minute break. And then when we come back, we have a video we're going to show you.
I have a question.
Yes.
I'm actually curious about Megan's question in the chat.
Oh yeah, let me see it. About the opposing behaviors?
And compensatory.
Right. So to compensate for low self-esteem, some people may say that they maybe, like, for example, with makeup. Do you all know anyone who may be a client or someone, like some clients say to me that they feel like they're ugly, that if people were to look at them, they would think that they're ugly. So they put on a lot of makeup to kind of compensate, for their perceived look of not being attractive, right? So then they'll put a lot to really build their self-esteem up, right? Or same with dressing up. They'll maybe dress up even real provocatively to be as attractive as possible so that they can be liked by somebody. And that's kind of an opposing behavior to the thought that I'm unlikable. So it's like opposing that thought of I'm unlikable by kind of like trying to prove it wrong. Does that
Okay,
make
thank you for clarifying. Yeah.
All right. Yeah, great question. Okay, so let's take a 10-minute break. We'll come back at 1:07 and then we'll get into the video.
Okay, Doctor, I have it loaded to the spot
Awesome.
that it needs to be at.
Perfect. Thank you. All right. Bethany has us set up to watch a video, and we might pause it in every so often, but we're going to go ahead and share it now.
But there was like a little bit of a case study beforehand. I was just going to read it briefly and then I'll play it.
Yeah.
That's
sounds
okay. Okay. All right, y'all. I have a lot of tabs open. Okay. So I'm just gonna read it. It's like I said, it's very short just to give a backstory, and then we're gonna watch a video. So just a disclaimer, this was a video that was used like a year and a half ago, so none of y'all have seen this video, but you might see some Tex-CHIP students or maybe students that you might recognize in the corner of the box. So just ignore that part. Okay, so this is the case of Sam. So Sam is a 13-year-old who has been experiencing separation anxiety from his parents over the past 4 months. Both of his parents contracted COVID 7 months ago and were in the ICU for 3 months prior to making a full recovery. So during this time, Sam had to stay with his grandparents and they don't live in his school district. So then, of course, he had to go back to virtual learning. So that's a process. So Sam had reported when virtual learning happened at his school, he wasn't able to learn well and he ultimately did fall behind. So they held him back a grade level and now he's doing the 7th grade all over again and is back to in-person learning. So anytime Sam or his parents have to leave the house, Sam mentions that he feels that he's going to throw up and his heart starts pounding. He stated he begins to have thoughts that he won't see his parents again or that they're going to get sick again and die. So Sam's parents admitted he started sleeping in their bed, and despite being 13, he's also starting to wet the bed at night. So while at school, Sam is constantly getting in trouble for having his phone out and texting his parents. He no longer engages in any after school activities because he wants to get back home to his parents. So he's been missing classes so he can go to the office to call his parents when his phone gets taken away in class. And on the weekends, Sam requests that both his parents stay home with him, and he refuses to go to his grandparents' house by himself in fear that his parents won't return to pick him up. So Sam's parents decided to seek out counseling for Sam when they noticed the bedwetting 4 months ago. And at this point in the video, he's been seeing his counselor for 11 sessions. So, of course, this isn't a real video, like a real client video, but okay. So now I'm going to share my screen. How do I share it? There we go. I'm gonna share. And I am going to need y'all to let me know with a thumbs up or something if you can hear the audio. Whenever y'all are ready. Hi, Sam. How have you been this last week?
I've been better. today I was able to get through my fourth period class without having to call or text my parents or anything. But after lunch, I started to get that feeling again.
Oh, okay. What feeling?
Like there's something bad was gonna happen to my parents.
Okay, so like you felt proud of yourself because you know what? We made it past fourth period for lunch, and then you started to think something bad was going to happen. Does that sound about right?
Yeah, I don't even know why it had happened because I was having a pretty good day until the thought popped in my head.
Okay, tell me what that thought was.
I just thought that something bad was gonna happen to my parents if I didn't call them.
Okay, so what did you feel like when you started having those thoughts?
Oh well, my stomach kind of felt like it was like knotting up, and
Okay.
I started sweating and I got dizzy and it just felt like I was gonna pass out.
Okay, so it sounds like you're having your normal physical response. What specific thought or thoughts did you have?
I don't know. I was thinking that like if maybe something bad happened to my parents again, and they're like maybe they got in an accident and just nobody told me, and I just thought that I wasn't gonna see them again.
So you're scared.
Yeah, I was really scared. It's like I don't like to like not see my parents. I don't want anything bad to happen to them.
Well, yeah, I mean, I can see how that can be scary for you. Like you were away from your parents for a long time and you couldn't talk or see them. And now you're afraid that that could possibly happen again.
Yeah.
So I was wondering if you've been able to work on some of the skills that we've talked about in our past sessions, when you had those thoughts of anxiety or while you were in the moment of having anxiety.
Not really. It was hard to remember everything when it was happening, but afterwards I was able to remember most of them.
Okay, so tell me what happened.
So I started getting the feeling again, and I asked my teacher if I could go to the nurse's office, and I was in there for about 15 minutes. And I was talking to my parents, and I went back to class. I missed my fifth period class, but I was able to go the rest of the day without like needing to call or text them.
Yeah, well, that's definitely progress. I mean, you remember where you were when we first started, like 4 months ago?
Yeah, it was. I was like calling them and getting out of class to call them and text them like every hour.
Yeah, I mean, you've come a long way. I'm wondering what it's like for you to reflect back on where you were then versus how you're doing now.
Yeah, I mean, it's kind of hard to like. It's nice to think like how much better I've been doing, I guess, compared to like now and back then.
Yeah, I mean, it's tough to recognize how far we've come when we're dealing with discomfort still, but we still have to be gentle with ourselves while we're making that progress.
Yeah.
And with that being said, let's talk about your stick assignment. Did you complete that this week?
No.
You seem to be a little anxious telling me that.
Well, I just don't want you to be mad.
I'm not mad. I mean, I wouldn't be mad. These assignments are for you, and these exercises are your choice whether you want to do them or not. I mean, I know since we started with the workbook and everything, the sticks assignments you haven't really been completing. Is there a reason why? Can you tell me some more about that?
Well, I just have so much homework for school, and I don't want to fail 7th grade again. So by the time I'm like done doing all my homework, I just don't want to do anything else. Besides, even I've been making like a lot of progress, and that's without me even doing most of the stick assignments. So
yeah, so you're getting run down, doing homework, and not wanting to do anything else, and you think since you've been making progress that you no longer need the stick assignment. Is that right?
Yeah.
Okay. I understand that, and I know it's difficult to keep up with like homework and the stick assignments and therapy and everything that you have, but on the other hand, you have to take some time and put some effort into your mental health. It's one of those things where you only get out the work that you put into it. And remember, that's just how counseling is.
Yeah, I'm still probably not gonna do it.
I mean, that is totally your choice. And all I can do is encourage you to try. Are you ready for what I have planned for us today?
Do I have a choice?
I mean, you do. You always have a choice what we do in here, but I thought we could talk about fear. Your fear working.
Okay, yeah, sure.
Okay, awesome. So, you've already learned how to identify your thoughts and your feelings in your body about how it responds to anxiety. So, you also have learned the steps coping, which is what fear is. So today we're going to practice fear a little bit more. Are you okay with that?
Yeah.
Okay. You want to go? Let's start from the beginning. So, F stands for feeling frightened, right? So identifying what you are feeling, and this is the first step in how you cope with those situations of being anxious. You recognize what your body is feeling tense or worried about something.
So like when I was feeling like dizzy and like my stomach got knotted up?
Yes, exactly. Exactly. Do you remember what the next step is?
E is like when I think something bad's gonna happen to my parents?
Yes, correct. So expecting bad things to happen. This would be recognizing the thoughts that are making you anxious or tense.
Okay. Yeah, so like me thinking like something bad's gonna happen to my parents.
Yes.
Okay, okay.
Yeah, exactly. So what about A?
I don't remember the last two.
Hey, that's okay. Remember A stands for attitudes and actions. So this refers to thinking about something that can make the situation less fearful. So what do you think you could do in those situations that you're feeling anxious or tense to relieve some of that?
Maybe I can take some deep breaths.
Does that calm you down?
Yeah, sometimes.
Okay, then yeah, taking deep breaths could be really beneficial for you. So let's go ahead and move on to R, which is the fun part. Rewards and results. So this is the last step of coping with anxiety, and it just means rewarding yourself when something that you do has positive results. For example, you today not needing to text your parents until after fourth period, that deserves a reward. What do you think would be something that you would like for that?
Maybe I can give myself 10 more minutes on my Xbox.
Hey, I mean, if your parents agree, that seems like it would be a great award. It seems like something that you can really help you get motivated, and it is important to keep those rewards in mind. And you got to remember also, it's as simple as telling yourself, good job.
I think I'll stick to the Xbox.
Okay. Well, if it works for you and your parents, then that sounds like a plan. So like I said earlier, we're gonna do some more practice today. So are you up for that?
Yeah, sure.
Okay. So if you go ahead and turn to page 48 on your workbook, there is a spot for us to pick a scenario where you can draw a character cartoon about coping with that situation. So which scenario would you like to do?
Let's do this one.
Okay. Can you read it out loud, please?
Drew has a math test tomorrow, but he's nervous he's not gonna pass because he hasn't been doing well in class, and he thinks he might fail.
Okay. So let's draw out how you think Drew could cope with this. Okay.
Okay. Okay.
That's cool. Tell me what's happening in it.
So Drew is nervous that he has a big test tomorrow and he thinks he's gonna fail. So his stomach starts hurting and he's kind of freaking out. But he stops, he takes some deep breaths, and then he feels better. He says, "I can do it."
Awesome. Good. Let's act it out.
What?
Only if you're comfortable. You're going to pretend to be Drew in this situation and act out the cartoon strip and see the results. Are you up for that?
Yeah. Okay, sure.
Okay, remember, it's only if you feel comfortable, and if you need to stop, we always can. Just let me know, okay?
Okay. So I just acted.
Mhm.
Okay.
Just whenever you're ready, just go ahead and stand up and act out the cartoon.
I have a math test tomorrow, and I'm not ready. I'm gonna fail. Wait. Do this. I just have to study.
Awesome, Sam. What was that like for you?
It was nice. I mean, Drew was really nervous that he wasn't gonna do good on the test, and some of that like anxiety was real, but the deep breath really helped me like calm down.
Yeah, I noticed you were a little anxious when I mentioned that we were going to do this. So like, sounds like you were able to experience some relief with it too.
Yeah, it's nice. The anxiety doesn't really last as long as it used to, I guess.
Yeah, well, I'm glad to hear that. You are doing much better.
Yeah, it's really nice to like be able to handle things a little bit more now.
Yeah, and you put in the work, so you got to keep it up, and you will get where you need to go. Speaking of that, do you know what time it is?
Yeah, time for you to give me my STIC assignment.
Yeah. Well, that's right, and I know it's not your favorite part, but we are here to these activities to get progress. So this week, I'm gonna have you practice using your fear tactics like we just did, with 2 situations. So that make you anxious. So you'll just describe each step of the plan as you use it and write them out for me. So does that make sense?
Okay, yeah.
Okay, great. When you come back next week, we'll talk about it all, and we'll go over it again. Do you have any more questions?
I don't have any.
Okay, cool. So I will see you next week. Have a wonderful weekend, and I'll see you next week.
Awesome, thank you.
You're welcome.
Okay. All right. So it is a bit exaggerated. They were from the drama department. And so that was the video that we have for today. I appreciate the commitment to the part. I definitely do too. They were really committed and they did so well. Okay. So let's just first talk about the case itself. Like without going too much into coping, Kat, let's just take it back to the beginning. What were some things that did stand out to you? Like maybe even diagnosis wise, like what do you think is going on with Sam off the bat? And if anybody has a chance to turn on their cameras, I know a lot of us at this point, we're kind of like peeking out, but just stay with me. We're almost done.
What stood out to me was his physiological responses to like anxiety or symptoms, I should say, anxious symptoms.
Mm-hmm. What else?
Thinking about like potential diagnostic impressions. Obviously, he has a lot of anxiety, and I'm thinking about maybe adjustment disorder and looking at, because so many life changes have happened so rapidly and he's having trouble reintegrating back into the school setting. And of course, I don't know his timeline or anything like that, but those are a couple of things that I would be kind of assessing for when working with him.
That's an excellent question. I mean, excellent point. Sorry, because this big life event did happen, and then there's that anxiety being away from parents. Yes, for sure. What about the rest of us? What else might we add on to what Ashley just said?
I'm thinking about maybe his own low self-esteem and maybe the belief that he has that he can't cope without his parents, or even just thinking about when the therapist had asked him about him doing the activities in between sessions, he immediately felt really like shameful about it. You know, like he let someone like really guilty, shameful about it.
Yeah.
I thought that would be worth looking more into as well, as it can help maintain the anxiety that's there and the core beliefs that I can't cope. I'm hopeless. One sec.
Okay, yeah, for sure. Okay. What else? One more person before we move on to the next question. What do we think's going on with Sam? If we're talking about anxiety disorders.
I was also going to look at adjustment disorder, like Ashley had mentioned.
Okay, thank you. All right. So I did notice this. I wrote like a bonus question. So again, before I talk about coping cat, like how might you have reacted if you were the counselor in a situation where kiddo maybe isn't doing some of the curriculum?
That is consistent working with teens. So yeah, it's something I experience often. But I also don't, so now I don't give homework, especially because I work with, I guess, I don't really like the term, but like at-risk youth. I work with at-risk youth, and they have so much on their plate. Homework is just adding something that I don't think is like, I don't know, I don't find it therapeutic in their case, I guess, because they've already been like so parentified. So they're already taking on so many other things. So we usually do activities together in session. So instead of like making it another assignment that they're like having to do on their own, I feel like I'm adding something else to their plate. We kind of walk through things together. I find that beneficial instead of just sending them off with something.
Yeah. So it sounds like you're going to focus really on doing that in session, and then rather than just like, okay, this is your job to practice this on your own because you already have so much going on in your plate. And even in Sam's case, he obviously has a lot going on. Okay. Erin, I did see you unmute your mic.
Yeah, I was just gonna say, like, as it relates to the video, I think if I was in the situation where a client, I had assigned homework and they came and they hadn't done it, I know you said they were from the theater department, but I would be a lot less reactive when they say they didn't. Definitely validating and reassuring that like it was a choice that they made, and it's not necessarily like a good or bad thing. And I just, you know, obviously emphasize that you're not upset, and yeah.
Yeah, for sure. Just validating, yeah, it must be hard. And obviously he was super anxious still. I know it was supposed to be session 11. I think that's what I said earlier. So there's some already background work that's been done, but the rapport seemed maybe not to be there. And again, it is a recording, it's a simulation. And that's also probably going to take some time with Sam's case for sure. Anybody else?
I think it would be helpful kind of tying to what, you know, Kendall was saying about just in terms of teaching the coping skills or activities, doing that mostly in session, and then over time, then having them choose from, like giving that autonomous choice to be like, what would you like to practice in between sessions to help, you know, ease your anxiety or what have you. What would you like to work on? So there is more of an initiative as opposed to like, oh, this is just another thing I'm being handed to, you know, or assigned.
Yeah. And so just leaving it up to them, giving them some autonomy. What do you think might help you whenever this happens in your day-to-day life? Like when you are at school, what can you implement that you've learned here that's going to help you? Got it. Awesome. Okay. So let's get into coping cat. So what did you notice? What part of the curriculum, like what stood out to you? How did they implement it? All that good stuff. Let's hear from someone who hasn't spoken yet. And I am not afraid to call on people.
Well, there was the drawing image that she had him do of creating a scene of what it might be like physically for him. I think they went through an acronym prior to, but it all kind of tied into this creating of a scene and how the kid would cope. And then him reenacting that role play in session to actually like feel what it is like.
Yeah. Thank you, Megan. See, what about Sabrina? What kind of stood out to you from the Coping Cat curriculum here?
I was also thinking about the role play. I think that's a big part of implementing the actual coping skills that they had talked about. And I think she did a great job of just kind of walking through it and validating, the fact that maybe he doesn't have time to add the extra task to completing the stick assignments, but being able to do the exercises with him during the session, I think is helpful.
Yeah, thank you, for sure.
So
Go on,
I'm sorry,
Dominic.
Beth.
No, it's okay, go on.
I was thinking about my client who has like some stage fright and how my like role playing together would look like and addressing anxiety that way. And so this was something like when she was showing it, I was like, well, this wouldn't be helpful for me, but really it could be helpful, like learning a task and then implementing it kind of while addressing public speaking and learning a new skill. So I thought this was a great example. Just props.
Yeah, and thank you for sharing that experience and how that kind of relates to what your own experience is like and how that would be helpful, for sure. Someone else. Okay, I'll call on someone. Adisel, anything else that stood out to you?
Nothing really stood out. I just like the fact that him having, the engagement with him, like her making him read out, the exercises with him. I think that honestly gets the client, thinking more and more involved. I know a lot of teenagers don't like to do that a lot. They just prefer, the client or the counselor or therapist to pretty much do everything. So when I was just, some people, I see in other sessions where therapists kind of just give clients handouts and, just do this. And I feel like it needs to be more engaging, more like to collaborative together work.
Yeah.
So
thank you. That actually ties perfectly into my next question. So we'll pivot there. So if you were the counselor, what might you have done differently here?
I would have leaned more into the emphasis of like systematic desensitization, because I feel like they touched on it, how he's like made progress, it was like the progress, but I feel like, and again, that was only like a little example session, but I feel like that could have been unpacked a little more, and like severity levels and how it's changed, regarding like anxiety, like how frequently he's fact checking by texting and getting in contact with parents.
Yeah, that'd be important to know.
Yeah, because fact checking works with one of my clients who has schizophrenia really well, but I think that leaning into fact checking as like a coping skill for him would almost kind of like reinforce, or maybe you would see an increase in him reaching out, calling mom, texting mom, or parent. So maybe unpacking with him.
Sorry?
So maybe unpacking that more with him, And like maybe I would have documented like a difference in severity level. So like documenting and keeping track as the entire sessions have been going on.
Yeah. And that kind of goes back to what we talked about in the very beginning with Dr. I about, I think you said, I know it is putting thoughts on trial, but, you said it in a different way, but I was like, oh, okay, that sounds better. But I say putting thoughts on trial. So like fact checking, what's real? Like, is this true? Like, what's the evidence for it? What's the evidence against it? Yeah, for sure. What else might y'all have done differently?
Maybe, because I'm still thinking about the client himself, but I would have wanted to focus more on his strengths. And in him talking about one of the reinforcements being that of video games, that kind of tells me that he likes to have fun. He likes to play, that's his approach to life. And so being able to reinforce that in session and being like to identify like that being a core strength of his that he can tap into, and maybe even doing an analogy with regards to tying like how anxiety is like for him in terms of like the video games that he plays, would also be more interactive and engaging as opposed to more instructional teaching role. So those are my thoughts.
Yeah, thank you. Salma raised her hand. Okay.
One thing, sorry, I'm kind of sick. One thing that like stood out for me was that when he asked him about the homework and he was like, no, and she like asked him about how like why he responded that way. I really like that because like I give my clients homework and I do ask them like, hey, did you get to do it this week? And when they say like no or something like that, I haven't like thought to ask like, oh, well, why did you say it like that? So I really liked that, and I was like, oh, I can implement that instead of just saying like, oh, it's okay, and then moving on.
Yeah. Yeah, thank you for sharing that. And also I hope you feel better.
Thank you.
And so I think that was like confrontive without being like, okay, so like why didn't you do it? So yeah, for sure. And even I, just for example, I guess I'm gonna chime in here too, right? If I expect y'all to participate, I will participate too. How I don't even like to call it homework because that just feels like an extra thing putting on their plate. And I really liked how y'all said earlier, just saying like, what can you do in your day-to-day life? Like, and I even asked like, what do you feel comfortable? And yes, we have a stick assignment that's in the workbook, but like, how can we modify and tailor it so that we can just practice it so that we can feel better in those moments that we're anxious? And I think that the script itself did a very good job at validating. And I think there are just maybe times for missed opportunity of just maybe going a little deeper into things, but that's, again, it's just because it is a simulation. It's like a case study. So we can't really get into everything all at once. And we don't know what the background of the other 10 sessions were. So, right. Let's hear from a couple more people before we continue.
Same question about what we would do differently. Well, since they're like pretty, depending on how long they plan on seeing each other, whatever, I feel like since they're like pretty far into counseling, I think it would also be like a helpful time to like maybe check in and get like feedback so far on like the client's perception of how counseling's been going so far in terms of like what has been helpful and what hasn't, and then like reevaluating what hasn't been helpful, or yeah.
Yeah, thank you, Esther. Just kind of having that check-in, and it sounds like at the 11th session that's probably a good point to check in. Hopefully they already did. What else? Or even if you learned something from the training that Dr. I just did that you might want to implement with this client, that could be a good one too.
I don't know if this has already been mentioned, but I always like to try to bring in whatever like interests the client has and incorporate that into the treatment. So really finding out, what things that they enjoy doing and then somehow tying that into the treatment.
Awesome. Yeah, for sure. Doctor, the only last question I have are takeaways. And before I ask that, I was wondering if maybe you had any questions or reflection points.
Yeah, I thought that the role play was great. And they did a great job for not being counseling students, right? So I really appreciated their help and support. And I like how this curriculum and the way they demonstrated it too. I like how this curriculum does have different activities happening throughout the session. I should have mentioned too in the beginning, it's good to have an agenda. It's good to have a session agenda to let the clients know what they can anticipate in the session. And if there's items that they want to talk about and process that may have happened during the week, to leave time for that, while at the same time you have things on your agenda that you're going to go through, which would be stuff from the curriculum. So I liked how they had done that role play and how she had him draw, and then how she had him act out and then practice relaxation techniques. I think all that was good. And then they processed it and talked about it. And so getting the client to be active in session, doing different activities, getting him stimulated in different ways, I think was really helpful. So yeah, it's really what I wanted to share about it. And I appreciate everyone else's comments too. And I guess I'm wondering how many of you would actually use this in session? Like, would you all use this with children? Would you use this with adolescents? Any questions about how to use it too?
I think for me, this would definitely be helpful for use with children because I don't think I really had experience seeing children at all. And I think this is a great structured way to like move through counseling sessions.
Great.
I think this would be helpful for maybe preteens who are a little bit nervous about being in session for the first time or therapy altogether, and going through workbooks could be helpful for someone who is like hands-on and wants to write things out or like detail oriented. So I'm thinking preteens maybe.
Right. Cool.
I was thinking, with regards to the exercise of how you would break it down from like moderate to severe stressors or severe anxious situations, and kind of putting yourself in like the child's position and kind of playing it out and being able to break it down. Not only would you be able to gain better understanding and know how to do it, but also like I think it would be helpful even for them, because if you're already in that high in arousal state, everything's just gonna be super anxious, from 0 to 100. And so being able to narrow it down and be able to identify like the leading up, the physiological experience of it. I think that's an excellent exercise I do plan on using more with adolescents.
Great. Very cool.
I would now, because I personally struggle working with any I'm just gonna say kiddos who aren't exactly like super young, but maybe between the ages of like 8 to 13. I'm like, and so I feel like if they're since there's this like manual, that's a really good way to break it down and just kind of walk them through it, because I felt so lost. I was like, I don't even know. So I really like it if I was gonna work with kiddos.
Yeah, it definitely puts it in like this language that it's more like developmentally appropriate, because if I were to just come into a session just trying to explain this, I know I will be struggling with bringing in clinical terms and all that. So having this workbook to sort of act as this medium and guide, I think would help serve as like the foreground for that communication to happen.
Yeah.
Awesome.
I'll be honest in that I don't like, even the teen one felt a little kiddie for at least the demographic that I work with. I don't know. Like I feel like it would be helpful for sure for them to like write stuff out, to have like guided imagery, stuff like that. But like I've utilized kind of like material kind of like this, like workbooky in sessions, and then I get like feedback from like they're like later age teens. So typically like once they hit like 16 to like 17, almost 18, I feel like that's when they want to dive into more like, you know, like straightforward and maybe deeper and adultish topics. So I do see this being good for preteens for sure.
Yeah.
I would like to try it with that population.
I could see actually using it also though with like adults who have certain, like maybe only like a 8th or 7th, 8th, 9th grade education level, because we also have to take that into consideration, like giving them material that would be suitable for maybe us or, you know, adults who have maybe graduated high school and stuff like that. Others probably wouldn't understand the language. So I could see that as well.
Yeah, I want to speak to that. There are a lot of clients that might have, you know, developmental issues, or their intellectual functioning might be lower. And so if they struggle with understanding their emotions and they struggle with managing anxiety, this could be a really great curriculum to supplement that. But also, to Kendall's point, yeah, like some kids just looking at worksheets like this, they think it's too kiddie, you know, and they already kind of shut the door on it. Well, you can definitely draw out the principles and the framework from it and utilize other things, like utilize just a dry erase board and just map out like their thoughts, right? Map out their, like using the personality triangle. You can still have like show that I can tasks. You can still implement role plays, but do it in a way where it's more mature for them. Any other comments or questions? Any questions about like the panel discussion? We didn't really get a chance to go into that earlier, but I hope that was helpful too. One thing I wanted to say is that I'm going to send you all a request to be open to allowing us to use the data we collect for Tex-CHIP for research purposes. And it's going to be, you know, de-identified data. But we not only do we collect your data for Tex-CHIP through your IDPs for program evaluation stuff, but we want to see really how helpful the Tex-CHIP program is in improving, you know, your utilization and comfortability with curriculums, with evidence-based curriculums, what the Tex-CHIP program has been like in helping you feel more comfortable working alongside other helping professionals, those kind of things, your counselor self-efficacy. So I'm going to be sending out an informed consent to see if we can, you know, have you all be willing to participate, so that we can compare, you know, your experience in Tex-CHIP to when you're done with Tex-CHIP. So thank you all so much for all your help. And if you have any other questions, that's all I have. Did y'all have anything else, Bethany?
I didn't have any other questions or reflection points I was going to ask them. Just thankful to y'all for showing up, and also to our panelists who agreed to come last minute, and they did fantastic. Thank you, Salma.
Yes.
Oh, do we stop recording?
Yeah, we can go ahead and stop.